Yeah.
Emily. Ti yw'r MC ar y pitches.
Yeah, na I taimio nhw.
Yeah. So os na I alw nhw mas, neu chi di alw nhw mas os fi'n cael yn wrong.
Okay.
Yeah.
A na I ddeud nhw, 1 minute each. A wedyn dwi'n siŵr ar ôl yr un gyntaf, na nhw gael y hang o maen nhw'n actually mynd i teimio ni. That's it.
A maen nhw mewn trefn, so maen nhw'n gwybod pa beth yw ei order nhw, dyn nhw?
Na, dyn nhw'n gwybod ordor nhw.
Ti ddim gael byddwn ni'n, ond ti'n mynd i roi y drefn yn y chat anyway, nag ti? Byddwn ni'n gwybod os sefylliodd.
So fydden nhw'n gallu gweld fatha ar y pryd, ond dyn nhw'n gwybod yn advance, chos oedden ni'n eisiau bobl mynd, I'll come in later, then I'm not until the end, math o beth.
Yeah.
Cool. Cool. Dwi wedi anfon yr link Zoom i pawb eto hefyd, jyst i checio. Mae pawb wedi cael notification. Here's the link handy. Mae na tua 130 di pressio ar Zoom.
Okay. Cool.
Quite there. A 9 keynotes yn y waiting room yn barod. Ti eisiau fi ddweud ar y dechrau sydd wedi iwsio Zoom i pawb oedd sydd wedi mutio hynna ag ati?
Sorry, gwna tro.
Ti eisiau fi ddweud yn y cychwyn, leave yourselves on mute, we'll start in a moment, just...
Na, mae gyda fi.
Am hwnna gen ti? Okay.
Yeah.
Cool.
Fyna. O, sana, ti'n gallu gweld e ti. Oh, dear. Right. Yeah. Na gyd I fi weir housekeeping. Oops.
O, na fo.
Yeah.
Cool. Oh dear. Fydd Chris Martin yn ddod i fewn chydig bach yn fuan hefyd, fydd yna adael o fewn os mae'n appealio. Mae Melissa'n dod, dydy?
Siwr o fod. Bydd eisiau'n galed I ti weld, a pwy ti wylo amdano fe, bydd Chris Martin yn galw fi, mae'n eiliad yna. Ti chi gweld e?
Diolch yn eto. Yna 10 yn y waiting room, a diolch yn un o heina.
Okay.
Nes I joinio yn meeting pnawn ma, ac oedd rwy'n dweud enw nhw fatha sod off, ac oedd nhw yn y waiting room, ac oedd eitha, guarantee bod y boi ma ddim yn gwybod bod pawb yn mynd I gallu gweld enw fo. A nath o joinio'r meeting a jyst fynd...
Siarad y Chris Amelia. Yeah, there's, I was just
Hi, Chris.
There you go. There we go. How are you?
Fine, thank you. How are you?
Yeah, not bad. Oh, I should have had a hat, shouldn't I? Really?
You're looking very smart with a tie, so I think you're okay.
You still got time.
I've been interviewing all day today, so it's been a bit of a long day already. But yeah, all good, thank you. Yeah.
Just quickly then, Chris, we're going to start off. Can you see this? Can you see the slide deck?
Yeah.
Yeah, I'm going to start off on that one as an opening slide. I'll kick off and I'll do a little bit of housekeeping. Yeah.
Yeah.
And I'll pass it over to you.
All right. Okay.
Yeah. Just to say welcome and hello and anything else you want to pull from the notes that you've got.
Yeah.
Yeah. I put this slide in because I wasn't sure if you wanted to cover the partners or not.
I was going to say that just before I hand back to you. Yeah. So
yeah. So I can hide that slide, Chris, because we don't want to dwell on a bunch of logos, do we? Or
well, leave it there if you like, and flick it when I come to the end if you like. And when I'm saying, I just want to thank partners and collaborators.
Okay.
And shout them out. So yeah.
I'll move it in at that point then.
Yeah.
So once you pass that slide, it's over to me.
Yep.
So I'm going to do a bunch of stuff. So a little bit about the background again, but I don't worry about me repeating a couple of bits that you're saying, Chris, because I probably won't cover much of anything that you're going to say, and it'll benefit from being said twice, right?
Yeah.
I'm covering the process, overview.
Yeah.
Yeah. And a bit more of an overview, but like next time, maybe, I mean, people are interested in offering some local support, aren't they, Emily? I forgot about that.
Yeah, that's right, yeah. Sorry, I'm just naming the rooms, I'm not concentrating.
Yeah, local support, maybe, yeah.
Sorry, Sean, on your list of collaborators,
yeah,
or particularly Betsy Cadwallader, Welsh NHS Innovation Leads, right? Okay, you've got it. Yeah. Okay. Yeah.
Then we're into running order for day one. Very quickly, I'm gonna bounce through these slides, right? Then we got some instructions about breakout rooms. Yeah. Because people are able to self-select breakout rooms, Chris.
Okay.
Now, what I'm going to suggest, Emily, because we didn't stop on this one earlier, I'm going to tell them that they should be able to go back into another breakout room using the breakout function. But if not, you're there to help them do it.
Yeah. And it might be worth as well, even though you'd think common sense would prevail, that if your name is Dave Smith and you've just pitched, then you should go to Dave Smith room and not go wandering somewhere else or anything. Sorry, my dog's just wandered in. Oh. So just in case they think they can just go wherever, they need to go into their room.
Go to your room. Go to your room, otherwise it'll be a job and a half to find.
Go to your room.
Yeah. So then we're into a little bit about running order day 2. I'm covering the finance again, a bit more detail, and it looks like that. Yeah.
Yeah.
Then a bit of talent spotting. One of May's slides there about other people who are here to take part. Some hints and tips which you've talked about before. Pictures of the panel.
I'll just say I won't mention the panel then. That's great. You'll cover that. Brilliant.
Yeah. A synopsis of the scoring, basically. Yeah. Strangely enough, we're not looking at anything different, but I'm going to focus on 2 things, Chris, when I come to this, which is speed and impact.
Yeah, well, I was going to cover some of that, so I won't cover it in detail. Yeah,
you cover that if you like. These are things that are important enough to say twice. So okay. Whatever you were thinking of saying, you say it. Yeah.
Yeah. Okay. But look on the details that you sent me where they've been registering. The key thing is this hack is all about our response to COVID-19. That's the drive for this. Yeah.
Yeah.
Okay. So that's why they need to be responsive, don't they? You need to be able to deliver this in a short space of time. Yeah.
Yeah.
Okay. Cool.
I think this time it's less of a COVID specific response, but more on the issues that COVID has provided. Melissa was quite keen to stress that. So it might not be a problem that looks COVID focused, but it's because of that we're having to be innovative.
Yeah, so it's all about our response to COVID-19 and beyond then, I guess, isn't
Yeah.
it? So it's a bit wider than just that, yeah, okay.
Yeah.
Yeah.
Then I got one slide just to finish off. Yeah, remember, you're all part of the, this is about forming teams. Everybody's got different skills.
Yeah.
Bring them all in together. Form teams, leave when you've had enough. See you next week. Right?
Okay.
We're then into, I'll use that slide then to remind myself that we're into pitches, at which point I'll turn the slide deck off and I will start introducing the pitches.
Yeah.
And Emily will keep time and I will introduce.
Okay, and I'll just watch that, and we can all watch the pitches, yeah, for the hour.
Yeah,
I'll leave at 8 o'clock or whatever time that finishes then, yeah?
Yeah.
So you've got 30, how many did I see? 36, was it, pitches?
38.
38.
That is ridiculous, isn't it?
That's crazy.
That is almost double the highest we've had before.
Yeah.
If they all turn up, it will be double. The highest number of submissions we've had before, 23.
Yeah. But that's on the basis, there's some juicy money here, really, isn't there? The percentage, which is why people have got excited.
Yeah.
Good. Okay.
Okay, so we got 2 minutes to roll in.
Oh.
What shall I do with a share then, Emily? Shall I just share and leave it and let it roll until we've from the start?
Yeah, why not? Yeah.
Might as well, isn't it?
Do you want to do it full screen like presenter? Yeah, why not? Because then people come, they automatically see the tweet thing, they know something's going to happen.
Yeah.
Cool. There's 48 in the waiting room at the moment.
And at the moment, I think people on an iPad, for example, are only going to see the slide, aren't they? And me in the corner, I think.
Yes, yeah.
Yeah.
Yeah. So are you controlling? You're going to tell everybody to go onto mute anyway, yeah? So I need to go into mute as well then, don't I? And then make sure I can come up when I'm,
They should automatically be on mute when they join.
Oh, they will. Okay, perfect.
So if anything, it's reminding them to unmute themselves when they start pitching.
Right, okay, good, yeah.
Do you want to have capital letters on your name there, Chris?
On my name?
Yeah.
Oh, how do I do that now? Come on.
Well, you can do it, or Emily can do it.
I'll do it for you.
Emily, you do it then, yeah.
I discovered that as host, you can change people's names.
Oh, that's brilliant. Right, okay. Yeah.
It's quite amusing.
There you go. Look at that, Emily. Very clever. Good.
Right.
Yeah.
Oh, do we want to have any music as we roll in?
Oh yeah, we did last time. I think it kind of helped. People got the tone of the event, didn't they?
Yeah, I can't remember what I wanted to do. I do.
All right, it's bang on 7. Shall I let them in?
Yeah.
Here they come.
Is that Chris Martin or Dean Martin who's in there?
I answer to any name, Chris.
That'll do. None of that nonsense. Right. Good evening, everybody. Welcome to the Welsh Health Hack. I am Sean Charles, and towards the bottom of the screen there, I think you can see the hashtag WHH 2020. I'm having a fiddle with my screen to see that a little bit, remind me what it is, but there we are. So I'm Deputy Director of the Bevan Commission, and the Bevan Commission has been a part of the collaboration of many organisations that brought this together this evening. And we'd like to welcome you on board. A little bit of housekeeping, just picking up on the theme of the moment there in some ways. You should be on some sort of mute as you enter, right? But if I can encourage you to stay on mute unless you've got something to say, because otherwise there can be a bit of disruption and feedback on these events, as I've discovered over the last few months. I would encourage you as well to make sure that your name appears next to your video image. And being R2D2 or V7/Z34 is an interesting name, but it's generally not too much use to anybody else. So if you're on a PC, you can click on your face. I think that's a right click on your face and select rename. If you're on a tablet or phone, generally speaking, you can select participant, select yourself and rename by clicking various buttons on the screen there. You might want to think about putting your name, your organization, maybe your skill, knowledge, superpower, intent, or interest into the box so that somebody can clock you before they start talking. But at this point, I will hand you over to the chair of the panel, Chris Martin, to welcome you into the event.
Okay, thanks, Sean. Good Lord, that's a photograph that was taken a few years ago. It's looking slightly older than that now. Anyway, look, very warm welcome from me to Croeso Iechyd. Great to have so many of us with us. So I'm Chris Martin. I'm the acting chair of the Life Sciences Hub Wales, and I'm also deputy chair of the Bevan Commission. And I think out of the 8 hacks that we've had, I've been involved in 6 of them and have chaired the panel on a number of occasions. And I'm really pleased again to be supporting this wonderful event, as I say, as chair of the panel. So the health hacks are probably one of the best things that I get involved in all year. They're inspirational people trying to make a difference to patient experience and indeed patient outcomes with amazing innovative ideas. And even more important, isn't it, that we're able to embrace this opportunity in these extraordinary times. And let me just say a really big thank you to all of our health and care staff who are attending this call tonight. You are doing extraordinary things in extraordinary times. You're probably very tired and worn out, but we really do appreciate the day-to-day work that you do on behalf of your patients. Diolch yn fawr iawn I chi gyd. Thank you very much indeed to you all for the sterling efforts that you're making day in, day out. What I thought I'd do then, Sean, if it's okay with you, I just wanted to give a few tips really. So we've got a huge response, as you're aware. I think there was probably something like 36 pitches was the last count. And I think it's important then just to make sure that you're focusing on what you need to do. So this hack is all about our response to COVID-19 and beyond. That's an important thing to note, yeah? To our response to COVID-19 and beyond. Things that you've learned during COVID that you can see that would be implemented going forward. Building back better seems to be the right thing to be looking at this time. But be clear what the problem is, what the challenge is, and what you're trying to fix. And understand the why, and then more importantly, the how. So how are you going to do it? So we're really keen on the Dragon's Den to understand about the deliverability of your projects. And you're going to do this with the partners who have joined us on this call tonight. So make sure that you're able to deliver in a timely fashion, yeah? COVID is not giving us the luxury of time, and therefore we've got to make sure that we try and do this with some haste. And just have a little think about, would you invest your own money in this project? It's a great leveler, really. So why would we want to invest in your project in order to drive this forward? So look, let me just say a few thank yous to great collaborators again this year, the Bevan Commission that both Sean and I are involved in the Life Sciences Hub, again, have been very instrumental in supporting, and Menai Science Park, Agor IP, Accelerate, the Welsh Innovation Leads, NHS Innovation Leads, and particularly our colleagues in Betsy Cadwallader, the Research Innovation Improvement Coordination Hubs, Medi Wales, Welsh Government, Digital Health Ecosystem Wales, and Simply Do. So you've already been through the platform that's provided by Simply Do. We want to say a tremendous thank you to all of those collaborators for supporting this event tonight and indeed in a week's time. I just want to say a special thank you too. We normally do this right at the end of day 2, but I do want to say a big thank you to Sean, Charles and Emily. Both of them work tremendously hard to make sure this event runs as smoothly as it can. And they are star performers wearing their hats with pride tonight. So look, enjoy tonight, enjoy next week. We're looking forward to all of these wonderful, innovative ideas. Just remember that you have to impress the dragons. Decisions will be made on the night, and then that will take you through to the next part, which will be the business plan. As you know, there's £200,000 potentially available. Sean will go through the detail in terms of what that might look like, from 5K up to 50K, depending on what the project is. And Sean will also focus on the key areas that we'll be looking at as dragons. Take note of those key areas, because it's important when you're trying to impress us. You've only got 3 minutes to impress. Make sure you impress us well. So be succinct, to the point, and be clear what you're hoping to achieve. So best of luck, everybody. If you want to get in touch with me, then please, only in brown paper bag. Folded cash is probably the best to try and influence the Dragon's Den. Now, I'm joking, obviously. Looking forward to all of the work that you're going to do between now and next week, and best of luck. Have fun. Thank you. Diolch yn fawr.
Thank you very, very much, Chris. I'm going to run through some stuff in quite ship-shape kind of fashion. I hope, so that people have got a little bit more of a sense of what's going on. For those who've seen it before, I apologise. For those who haven't, I hope you find this all informative. So there's a list of pitches in the chat, right? There's an order to the pitches. There's a number and a name. That basically gives you a bit of a sense of where you're fitting into the running order this evening if you're pitching. For those who aren't pitching, it gives you a reminder of who you've been listening to, right? Because it's important that you make note of the projects that you're interested in talking to, and maybe a note of which one you'd like to go to first, because you can make your way around different projects with different chats and different breakout rooms, right? There is a link to the Simply Do platform in chat as well. And I think at this point, I'm going to ask Joseph from Simply Do to say a couple of words about the platform.
Thanks, Sean. Appreciate it. It's really, in this instance, just a note for challengers, really, to think about. The template, the idea template for developing the idea now, obviously on the back of your challenge, and it's aligned very much to the judging criteria that judges will be thinking about next week. That's now been placed underneath the challenge that you've had accepted, and it's accessible in the Simply Do platform in the same way that you would have been accessing your challenge previously. So please do go in and have a look at that, and you can use that as a guide. You're actually able to add collaborators to that idea now as you work through it as teammates, and you'll see that tab in your challenge that you can add people to it. If you meet people who you want to collaborate with and they're also registered in Simply Do, you can just click on teammates, pop their name in, and they'll show up and you can add them. It works very much like a Google Doc or a shared document, so you can both edit simultaneously and save it, and that'll help you obviously work towards your idea pitch for next week. I'll pop the link into live chat if you're not registered, and that'll take you straight through to register if you need to. Thanks, Sean.
Brilliant. Thank you very much, Joe. These slides are moving forward, Mandy. Right. So a little bit of background. I won't go into it too much. This is the 8th Welsh Health Act. We started in 2017. So we've been running 1 or 2 every year since. This is the second one online. It's about solving operational or clinical challenges. It's about collaboration. It's about risk sharing. It's about innovation, developing new solutions to challenges. And it's about building networks and opportunities. I'll focus a little bit on the nature of collaboration and risk sharing, because winners this evening will be asked to contribute something to the pot and to the activities and resources, maybe around delivering challenges. So picking up on Chris's point earlier, you know, when we see presentations next week and when we start to kind of divvying up cash and to the winners, we'll be looking to see what everybody's contributing to this event and to developing solutions. Right. Okay. So overview is that we've already submitted challenges. Tonight we'll see people pitching challenges. We'll move on to a session around solving challenges, which is very informal, network-based, and in breakout rooms, where hopefully you'll be able to form teams. Don't worry if you haven't formed teams this evening. You've got until next week to sort all of this out. And next week, then on the 17th, it'll be presenting your solution to the challenge with your team. Right. So once you presented, if you happen to be victorious, right, you move on to along the yes line to finalize funding, access some support and deliver your project. If it's no, better luck next time. But what we have found is from the last hack, one of the projects that weren't successful has gone on to securing a substantial amount of money from government to develop their projects. So I wouldn't feel too disheartened. You'll get support. You can push things forward. Hopefully you'll have developed collaborations with companies who want to work with you. God, the slides are slow switching over, sorry. Right, a little bit more detail on the running order. Log on, NHS pitching, hopefully starts around about now. Networking after that, forming collaborations and finish, yeah. When we put you into breakout rooms, I mentioned this earlier, but keep a note of where you want to go first. Remember, you can go to many places. Make a note of the pitch number and the picture, because that's what the rooms will be titled. And when it comes to it, we will ask you to select a room and you can go to that room yourself. Once you've had enough of being in that room, you can leave it whenever you like. And you should be, we believe anyway, able to select another room by clicking on breakout rooms and picking a room. If you can't do that, Emily there with the blue hat will be able to help you move into another room. In each room there is a facilitator. Some of them should be wearing hats, but they might have forgotten, and they're there to help you with anything that you need at that particular point, maybe something technical, or they can go off and try and find people for you to collaborate with. Running order for day 2 on the 17th of November. It's a 7 o'clock start. Presentations. We think the presentations will take about an hour and a half. The dragons will retreat into a room to consider decisions, and we should see winners announced at about 9 o'clock. Yeah. Hope all of this is having a little bit of a flow and some sense to it. Funding. So there's £50,000 that we've had from health within Welsh Government, £50,000 from economy in Welsh Government. There's £100,000 earmarked within Agor IP for the right projects, bearing in mind that you need to meet the Agor slightly different criteria for projects. We'll be looking to support worthy projects only. So don't think about yourself in terms of we're selecting 5 or 10 or anything similar. We will pick the projects that we think are worthwhile. In terms of a guide, I'd be thinking sums of £5 to £20,000. If you're looking at a first step, maybe in terms of getting things going, we can think more, but I'm trying to guide you in a certain direction around this. We will milk this for all we can get.
So what I'm going to try and do is we're going to try and make this funding stretch as far as we can. And we'll be looking for variations in collaboration and organizations to contribute to projects, either in terms of cash or most probably in terms of resources and people's time. And as I said earlier, you know, the event basically puts you into the next step for accessing funding. That's not to suggest that we'll change our minds and not give you any money, because we've never done that and we're unlikely to do it. But there is an extra step within this process to make sure that the collaborations are sound, and that we're not giving people money to go off on holiday. God knows where you go at the moment, let's be honest. But we don't want to be giving you, we don't want to be funding people's holidays. A number of organizations will be using this evening as a talent spotting exercise or headhunting to see if they can find their own projects to support. So coming off the back of this event, you may find yourself working with any number of different organizations or being contacted by different organizations. Don't be surprised if they contact you. You know, your contact details are on that website, and they will have seen you this evening, and they will have probably spoken. But these are all sort of government-funded organizations, and their intent is to support economic development and to support better healthcare within Wales. So I'd encourage you to work with anybody on that list. Some hints and tips. Make a note again of which challenge you want to talk to. I guide you to be patient. There is plenty of time this evening. I didn't pick up on it earlier where I meant to, but you know, we've got this listed as a 9 o'clock finish. That is basically a lie. You can finish anytime you like. And we'll be keeping the line open probably until about 10 o'clock because we want to go to bed and stuff as well. But the idea is that we will keep this open as long as we can to help you form the collaborations that you need to this evening. Be flexible. There are currently 111 people on this call, right? That makes your idea 111 to 1 as being the best one. So be ready to have a conversation with other people about things, to listen and to adapt your ideas. Manage your own time, and in particular, I would warn, maybe not this evening, but during the week, beware of scope creep. Pick up on Chris's point about delivery, right? We're looking for things that we can deliver. So things that deliver the world, the universe, and everything are going to look a little bit risky from a panel's perspective, and they'll probably err towards the stuff that looks more like it'll get delivered within a short period of time, and therefore most likely have impact on COVID. The panel next week, Chris Martin, who we've met, Abby Phillips from Welsh Government, Cordelia Brysiart from M-SParc, Simon Burnell, one of the winners from May, from Betsy Cadwaladr, John Antoniazzi, who's a Bevan Commission advocate and does some stuff with us from a patient perspective, Bernard Jones, Magor IP, me with my horns as well as my hat, and Rupert Jones from Renishaw PLC, who's offering an independent industry perspective on this. So we like to think we've got a nicely well-balanced panel there of people who are funding and people who know their stuff. If you want to impress the judges, again, a little bit of repetition, but this bears repetition. There is evidence of need and clear benefit. The solution can be delivered in good time. You snooze, you lose. You've got to be ready to roll with a solution. We're not looking to spend the next 6 months doing some analysis. We need action. All together, which means you're in there sharing risk rewards and contributing to the project development. How well the patient and the NHS staff's perspective are understood in the proposal. And again, you know, the large scale impact, the potential for integrated care, and how we can impact on the challenges that COVID are presenting us with. I encourage you to think as well of yourselves as Power Rangers. Power Rangers, as we all know, I imagine, have various skills, and they contribute something to the team. Neither of them is able to beat the Goliath by themselves, but when they collaborate, they can, right? So remember, this is about collaboration this evening. Form teams, leave when you've had enough, and I will see you next week. Right? So we are on into the pitching elements. I I think if you've got a couple of questions, maybe drop them into chat, maybe Emily pick them up. But here we are. So over to the Muppet Show. I'm going to stop sharing the screen so we can see people's faces when they present. And Emily, can you remind me, please, because I haven't got this open. Who's first? Oh, I love it.
I made the classic mistake to start us off. The first one is Pascal in Nominato.
Brilliant. Pascal, 1 minute, please.
Hi, shall I start straight away?
Start straight away and I will time you.
Okay, hi everyone, I'm the icebreaker. So I'm Pasquale Nominato. I'm a consultant medical oncologist in Bangor, Ispiti, and I'm trying to develop a solution, a digital solution that will empower cancer patients to basically develop a healthier lifestyle during this COVID pandemic, but even regardless. And by doing this is offering support that is very tailored to their needs. So I'm planning to collect patient-generated data, so patient-reported outcomes and passive sensors like wearables, and then developed a very focused, tailored coaching that involves stress management, sleep improvement, and physical activity and bright light therapy, especially in this period. And I'm looking for commercial and academic partners to develop this idea for the benefit of our patients. So thank you.
Thank you very much. Room number 1, Pascal. Hey.
Oh, so that was extremely well timed, Pascal. Well done.
Thank you.
Yeah, setting the tone for the evening. Alison Bishop.
Alison, if you're with us, can you unmute yourself? Alison has confirmed she will be here.
Okay, we'll move on. We'll come back to you, Alison. Can you note that one for me, Emily? Robert Kane, where are you, sir? There he is.
I'm here. I thought I had another minute to prepare. Never mind.
Sorry about that.
I'm sure it'll make a huge difference.
Yeah. So my name is Rob. I'm a physio. I work in Betsy Cadwallader in the West, and my challenge is about triage and basically trying to create efficiency and cost savings as part of triage as a sort of follow up to COVID, if you like. So we spend a significant amount of triage time every day. Over the course of a week, we spend approximately 25 hours at a cost of about £600, which doesn't seem like a lot, but it's significant. It's equivalent to about 1 member of staff over the course of a year. The triage process is key to the success of our physiotherapy and CMAT service, and that's very important. And it's also a very important characteristic that our current triage process works, but it could be better. It could be more cost effective and it could be more efficient in terms of the time that it takes. So I'm looking at people to help universities, higher education, industry to try and develop some technical solutions to try and improve our triage process. We also have director approval as well.
Perfect. Well done.
Magic. Thank you, Rob.
I'm impressed with these so far.
Fantastic. Rob Kane there in room 3. Yeah. Carla Blee, room 4. Hello, Carla.
Hello, I'm a consultant in sexual health and HIV in North Wales and Central area. Just imagine you've got a 19-year-old who lives 20 miles away from your clinic who is diagnosed chlamydia positive. It's a 30-minute drive or an hour and 20 minutes by bus to get there. You know, the quicker you treat her, you reduce the risk of complications to herself and onward transmission. But here's the problem. She doesn't drive. And because of COVID, we have fewer sites where we are able to dispense medication from a sexual health clinic. And yet we know there's a fantastic network of community pharmacies who are able to provide that service. Patients are asking, why can't I just go to the community pharmacy to collect it? And that's the challenge. We can't currently digitally transfer or electronically prescribe to our community pharmacies to increase our patients' access to care. And what I'm looking for is people with the digital know-how, how we can make that a reality and solve that problem for our patients.
Magic.
Another perfect time. Well done.
Carla Blee in room number 4, everybody. Robert Letchford, room 5. Hello, Rob.
Hi, my name is Rob. I'm a physiotherapist in Cardiff and Vale We know that the best science, clinical and patient experience all tells us that lifestyle and physical activity interventions can be extremely effective across healthcare. However, engaging people at the intensity required has always been a challenge, and that's even more so in current times. So currently, our staff have got an average of 2 hours of virtual interaction in any 3-month period, leaving around 2,000 hours of independent self-care for most individuals. And our objective is to better utilise those 2,000 hours to improve health. So the vision is a community which enables active participation in lifestyle and physical activity interventions in these challenging times. And I guess that's the challenge. Can we create a clinical test bed to rapidly implement and evaluate tech products that could support the community to utilise those 2,000 hours of self-care more productively?
Lovely. Thank you very, very much, Rob. Rob Letchford in room 5, everybody. Right, Rakesh Kumar with 3 challenges, one after the other. I'll give you 3 minutes in total, Rakesh.
Oh, that's great.
So you can load balance between these, because I know you. And this will be room 6, I think. Will it, Emily, just to check?
Yes, and I've helpfully named them 6, 7 and 8 so that people remember there's 3 challenges there.
Over to you, Rakesh.
Thank you very much. I'm Rakesh Kumar. I'm a clinical specialist physiotherapist in Betsy Cadwallader in North Wales. I suggested 3 different challenges. So I got to see 3 different challenges. So I'll start with the first one. This is called digital name badge. So the challenge is a normal badge is hard to say because of the social distancing nowadays. So it's very hard to see what's written in there. And many times, if you believe me or not, it's flipped other way around. So it's very hard to say what the name is it. And a person who is saying you can't, awkwardly, they can't ask you, can you flip it other way around? So, and it just makes a huge difficulty in communication. So what I'm expecting, if it's similar like that, is like a mobile phone screen. So for example, if you got a screen mobile like that, and it can be seen both sides. If it's flipped other way around, it can be seen, and it need to be cost effective and can display the text as well. For example, when you got a mask, and if you're speaking through the mask, so it's hard to say. If this one display the text on there, that will be brilliant. So that's my first challenge. The second one is regarding the group exercises. I'm a physiotherapist, we try to deliver exercises, but it's very hard to do it nowadays because of the COVID. So it will be nice to have something VR system which can be connected. Say, what if I'm controlling from one room and other people, they are sitting in the different rooms or in their own house, but they can be in different on their own virtual reality with the VR set, or if they don't like to, they can see on the TV screen. So that's something I'm looking for. And the third challenge is something with mobility aid. Usually as a mobility aid is I work with the people with dementia. So a lot of people, they struggle to remember to take their frame, and there's more risk of falls. So it'll be nice, some simple device, very basic device, which can be attached with walking aid. And when the user is holding it, it shouldn't make a noise. As soon as you leave it, it just start making noise. Something recorded voice say, Mrs. Jones, can you take your frame? Probably it'd be nice to have something with familiar voice, like daughter's or son's voice, something like, Mom, can you take the frame, please? So something like that. So it just it needs to be very basic, cost effective. So just attach it. It doesn't need to be charging, something like that. So you can charge when you're walking. So that's my third challenges. Thank you.
Brilliant. Thank you very much, Rakesh.
No
in room 6, 7, 8.
Yep.
Room 9, Jackie Dorian.
Hi everybody, I'm
Hello,
Jackie
Jackie.
Dorian. I work for the third sector, believe it or not. So it's like nice to be here in this room with lots of professional health professionals, etc., etc. I'm looking at growing our stronger communities, so looking at how equitability is across everywhere for each and every individual, so how the third sector can actually support everything that you're doing. So for example, I was really interested in what Carla was saying. How can we support? You know, we've got a strong, vibrant third sector. How do we get equitability for every person, right from early age, right up to older people? I think that we can certainly help. There's a lot of digital platforms available to people, and very much about remembering lots of people aren't digitally included. So that's face-to-face. I know we can't do that, but face-to-face somehow, or phone calls, going back to the old ways of working. Thank you very much.
Thank you very much, Jackie. Nice to see non-NHS representatives in the room. Next up, 10, Tom Power.
Hello everyone, Tom Powell, Cwmtaf Morgannwg Health Board. I'm interested in the way that people speak. I think there's lots of information there that we can use to help and not to diagnose, but to monitor what's going on. I've already done some work on this in respiratory patients, but it's well known in Parkinson's and muscle wasting conditions. Modern technology, computers make it really easy to get lots of really valuable information. And my challenge is to work with digital tech experts to try and get deployable solutions that we can use to help people, mainly in their homes, where we can look to care for them and find out when they might be starting to feel more poorly more quickly. Thank you.
Perfect.
Thank you very much, Tom Powell. Then group 10. Next up, 11. Who's doing this one, Kimberly? Is it you or
11 is going to be Dr. Sam Rice, please.
Sam Rice.
I know Sam's here because I've seen him.
He's running the COVID ward at the minute. He might have had to dash off.
Oh, but that's
Have you got his little film, Emily? Because he pre-recorded it in case the Zoom link wasn't good enough, the Zoom connection.
Oh, yeah, let me get that up. I can play that now. She says optimistically. It's opening on my computer. We'll just give it a second. Oh no, it doesn't want to open. Hold on. There we go. Hang on a second. It is 59 seconds, so we'll play that. I don't know if there's a picture, if it'll just be sound, but I'll share that now. If it will let me, which it's not doing. Share computer sound.
I'm a consultant physician. I'm working in the COVID zone of my hospital for the second wave. I'm here not because I'm particularly an expert on COVID, but because I'm the only senior clinician within the hospital to volunteer to work in this area for the second wave. The individuals that are working in this area during the first wave feel that they are neither physically or psychologically capable of working in the zone as they were previously. I feel that potentially I'm more able to function in this zone now because I've always had an interest in resilience and have attended various sessions on such. We do have psychological support available for clinicians, however none of the senior team have accessed this. What I'm looking to do is to generate some content and have a system which is deployable within the environment where we are now currently based, that is usable and effective. Is this something that you are willing to help with? Thank you.
There we go.
That worked.
That worked.
Great. Always a result. Worked. Great. Right. Where are we going with 12? Is that 11 and 12?
That's 11 and 12 will be Professor Keir Lewis, I believe.
Ah, Keir, you there.
Hello, everybody. So I'm one of the other acute physicians doing COVID at Prince Philip Hospital, Llanelli. I led down the first wave and I'm involved in the second wave. What I found looking at the first wave was what's happening to all the patients after we've discharged them. There's 600,000 people at the moment with COVID in the UK. There's 1,100 people in hospitals in Wales, but there is absolutely no systematic way of following these people after discharge. I am being flooded in my respiratory clinic with people asking for help, even those who have not been admitted to hospital. And currently I have access for just one clinic a week to only see 5 patients. So the demand is great, the demand is immediate, and the demand is growing. What we don't have is a way of triaging these patients to see how ill they are and how they progress. What I hope to do is to work with a group of people, with developers, to base apps to patients to monitor them and offer videos to them, and hopefully pull them into secondary care and specialist clinics if we see they need that help urgently.
Thank you very much, Keir. Can I check, Emily? Is Sam and Keir in room 11, 12? Or
Yes.
Yes. Okay. Brilliant.
No, sorry. So Sam is in room 11. Keir is in room 12.
Okay. Fantastic. Thank you very much. 13, Nicholas Reed.
Thank you. I can't see myself, never mind. My name's Nick Reed, and I'm the pharmacy
You
lead.
can, Nicholas, you're fine.
Fine, cool. I'm the pharmacy lead in the antimicrobial resistance programme in Public Health Wales. AMR is a real and immediate threat, and highly drug-resistant pathogens are causing infections and deaths in our hospitals today. It's estimated approximately 2,000 patients are dying each year in the United Kingdom of untreatable drug-resistant infections. And part of my role is to try and slow and the development and spread of these pathogens in Wales. As the antibiotics we all grew up with fail, it's vital to ensure that the drugs that are left are used as wisely as possible, with treatments tailored to the individual patient. My vision is for better informed patients and prescribers working together, using the best diagnostic tools linked to intelligent clinical decision support tools to guide the advice and treatment each patient receives. And to help me deliver this vision, I need IT developers, clinicians and patients to help me design an intelligent technological solution.
Fantastic. Thank you very much, Nicholas. Nicholas Reed in room 13, everybody. Muli Doddy, I think.
Yeah. Good evening, everyone. I'm Mauli, and my challenge is ENT specialist online. Now, the pandemic has created a patient waiting list that will take 5 years to clear. This ENT specialist online is a digital solution that can clear that waiting list in 6 months. Now, how do I do that? We use technology. We eliminate the traditional barriers of 9 to 5 working with consultants and patients doing video consultations during their free time in the evenings and weekends. I'm looking for a technology partner who can deliver this using the available white label technologies and seamlessly integrating them into a platform. Thank you.
Fantastic. Mauli in room 14, everybody. Dave Smith in 15.
Hi there, Dave Smith. I'm one of the head and neck surgeons down at Cumtar. Currently, we're under the 62-day waiting list to try and get our cancer patients through. And to date, all that coordination of care to get them through that pathway in 62 days is being held on a number of disparate systems. So we've got data on a number of different sources that we're having to try and collate together, and that's taking a lot of man hours for our clinical nurse specialists. I just feel there's got to be a digital solution which can start integrating that data into a single source, which is more manageable and usable by us as clinicians, and allow better and more efficient tracking of patients through their cancer pathway. So that's the solution I'm trying to solve.
Thank you. Thank you very much, David Smith in room 15. Samantha Chadwick in 16.
Hi, my name's Sam. I'm a paediatric and LD physio over in Betsy Central. So I already have a paper format of my passport that I use with some of my complex needs children and some of my adults. And I basically need to make it digital. So information gets lost when they're transferring between schools and home, or if they're going to respite, or worst case scenario, they get admitted to hospital. And the idea is, if it's held in a digital format, that anybody that's given authorization can access that information. More so, it's important for hospital admissions, because 70% of adult LD admissions result in aspiration pneumonia, which is primarily due to poor positioning. And this information is held on their passport. It will give vital information to staff about how they need to be positioned for eating and drinking, but also with children and the equipment that they need.
Lovely. Thank you very, very much, Samantha. Samantha Chadwick in room 16. Carsten Eichmann in room 17.
Hello, good evening. My name is Carsten Eichmann. I'm a consultant anaesthetist in Ysbyty in Bangor, North Wales. And my challenge is to find a technology answer to measuring urine output hourly. So a little bit of background: urine output will indicate physiological wellness, patient deterioration, and it helps us with assessing the response to treatment. What happens at present is that every hour or every 5 hours, a nurse or a doctor, mainly nurses, have to go and measure the urine output manually and then record it, which is time intensive. I'm not aware of any automated process. I'm not aware of any record keeping. And in the time of COVID, where we see increased renal failure and increased numbers of seriously ill patients, it would also help nurses to reduce their access and keep distance to the patients. And it should follow health standard guidelines and be reusable where possible.
Brilliant. Thank you very, very much. Carsten Eichmann in room 17, everybody. Madeline Boots.
Hi everyone, my name is Madeline. I'm physio and lecturer at Cardiff University. Inactivity is a key cause of pain and increased risk of serious conditions, which puts unnecessary and avoidable burden on the NHS. So national guidelines put healthcare professionals at the centre of giving advice on physical activity for public health reasons, but the compliance in delivering that can often be affected by a lack of time, lack of resources, or accessible information. So to be able to offer tailored advice on what physical activity is suitable for a patient, how they can access it, where dealing with obstacles that may prevent them from being active would help engagement with physical activity. So the challenge here is to create a sustainable database to guide healthcare professionals through this process and allow them to filter physical activity provider information and signpost patients specifically to providers in one efficient and time-saving resource.
Fantastic. I love the timing.
That's brilliant. Everyone's doing so well.
Boom, boom, right. Madeline Boots, everybody, in where? In 18. 19, Alexander Lavarnos.
Hello, everyone. Can you hear me?
I can.
Hello, my name is Alexander Lavranos. I'm a genetic technologist and I work in Cardiff Valley University Hospital Trust, University Hospital of Wales, in the All Wales Medical Genomics Service. That's a bit of a mouthful. My challenge is to create a whole genome sequencer. I've got high dreams, high expectations for this. I've been working on this for about 2.5 years now. Basically, genomic science has come a long way and is integrated into mainstream NHS services. We serve patients across the age spectrum, and basically sequencing has come a long way now to the point where it only costs about £600 to sequence a patient. I want to try and beat that, make a portable point of care device, which will basically be able to be used on site by the patient to get a result of their genome. This can be used prenatally, in cancer, rare diseases, but also in infectious disease as well. Towards that end, I've made myself a startup company and I'm basically looking for funding.
Fantastic. Thank you very much. Alexander Lavranos in 19. 20 and 21, Sarah Gray, please. Is this 2, Emily, I assume?
Yeah.
Okay, 2 minutes. Sarah.
I don't see Sarah, there is.
Or not, as the case may be.
I'll check if she's here. Maybe she's stuck on mute. Nope, we'll have to come back to Sarah.
Should we try Alison Bishop again then, whilst we're thinking about picking people up? Alison?
No, she's not in the room.
Okie dokie. All good for everybody else, by the way. You know, this is just less competition, in case you're wondering what's going on here. Any way of eliminating competition, feel free to try to do and deploy any strategies you have. Savita Shambat, how are you again?
Hello.
So I'm Savita Shanbag. I'm a GP in Havildar and a cancer lead GP in the same area. And my idea is to have a primary care app which helps professionals, be it GP, nurses, social prescribers, signpost patients to the right third sector or charity. This will improve efficiency in the system as it connects the end user, who's the patient, with the provider. It's a prudent solution. We don't know exactly how much time GPs spend on tasks like this, but patients do call us for non-medical reasons. So if we have an app that has an up-to-date information of the charity or third sector response, with the charity being responsible for keeping their contact details up to date, we can signpost patients easily. There's also an option to have a patient-facing side of the app, which patients can direct themselves to. And that's my idea. I'm looking for help to build this. I've run it past professionals with over 20 years experience, but they are not from Wales, so they can't help me build it at the moment.
Sorted. Thank you very, very much, Savita Shanbag, everybody, in room 22. And 23, Simon Fountain Poli. Are you there, Simon?
There's no one with that name in the chat, so potentially not.
Okay. Oh, look out, here we go. John Wells, he's bound to be there. John Wells, 24.
Hello.
Hey.
So skin cancer is the most commonly diagnosed cancer in Wales, and the majority affect the head and neck. Following treatment, scars and deformity can have a significant impact in the lives of those affected. And in all trusts in Wales, the patient journey is currently managed by a tangled web of legacy systems, each dealing with a different step in the process and barely fit for even their own limited purposes. The gaps between these systems are filled in with handwritten notes, which breaks the link between treatment and outcome data. A high turnover of patients means that small improvements in our techniques and responding to patient feedback on their experience can translate to a measurable impact on the patient's quality of life. The challenge is to create a single record that tracks the patient journey and maps treatment and outcome data, reduce administrative workload, errors and omissions, and most importantly, facilitate continual improvement and measurable impact on quality of life. The pathway, processes and treatments are straightforward and predictable. They're also common to all specialties in Wales providing this treatment, which will greatly facilitate deliverability and scalability of the final solution.
Thank you very, very much, John. So John Wells in room 24, everybody. Debbie Taylor in 25.
Debbie. Sounds where you guys are starting to bump each other off now.
We'll find out where you live, come round. Don't open the door if somebody comes round tonight, right? It'll be so.
Hit that on each other.
Natalie Elliott.
Hello, I'm here.
Natalie will be here, I thought. Yeah, here we go. Right.
I'm here. Good evening, everybody. I'm Natalie Elliott. I am a National Allied Health Professions Lead for Dementia Care across Wales. And I'm here to talk about people with dementia who are having particularly, have been hard hit by the COVID pandemic. And one of the things they've told us is that they're very fearful for going back out into our communities and re-engaging with activities that are so important for their well-being, and that they have forgotten how to do some of these things. And obviously things have changed a lot as well. So we want to create some video clips of what things look like out in the community. And my challenge is to find a portal where we can store these that are really easy for access for people with cognitive impairment. So I'm looking for partners and ideas on ways that we can store these clips in an accessible place. That's my challenge.
Thank you very much, Natalie.
Thank you.
Natalie Elliott in 26, everybody. 27, Duncan Forbes.
Thanks. Good evening, everybody. I've worked as a chief exec and board member of housing associations, been a non-exec member of Powers Teaching Health Board, senior officer in local government, and led on prevention. But I'm working with a collaboration of 10 housing association chief executives The communities we serve, the Black and minority ethnic communities in Wales and deprived and marginalised communities, are exactly the people who've been hardest hit by COVID. We don't have any health expertise, but what we do have is expertise in community engagement and communication with those communities, with people who don't have internet access, with people who have literacy issues, with people who don't have English as a first language. We're in and out of people's houses, we're on regular telephone contact with them, we know their household composition, their vulnerabilities, we're in contact with community leaders and community organisations. We'd like to find a way of using that resource to help tackle inequality, and most urgently in protecting people from the next wave of COVID. Thank you.
Thank you very much, Duncan. Duncan Forbes, everybody in room 27. William Thomas in 28.
Hi, Gwilym Thomas, pharmacist in Betsy Cadwallader, specialising in anticoagulation. We got a problem with direct oral anticoagulants, which are important in reducing the risk of stroke and systemic embolism. We found in pre-COVID that 20% of these patients are on the incorrect dose, increasing the risk of this happening to them. So what we had initially was a Excel spreadsheet that calculated the dose for the patient and communicated from secondary to primary care. I'm being informed that that's not possible to continue because it hasn't got CE marking. So what I'd like is to help into improving the communication from secondary to primary care and ensuring that the patient's on the correct dose of DOAC.
Brilliant, diolch yn fawr, Gwilym. Gwilym Thomas in 28, everybody.
Diolch, William. We went to school together. Hiya.
Hi.
Hey, and that's a small world, isn't it?
Small world.
Especially on my screen. Arfon Williams. Same neck of the woods. Are you there, Arfon?
I can't see Arfon listed.
No? Okay.
Nope.
Muthi?
Muthi. I've seen Muthi earlier.
Hello?
Hey, there you are.
Oh, there you are.
Hi, I'm Muthu Ganapte, one of the hip and knee surgeons at M-SParc in Bangor. As you know, all patients after hip and knee orthoplasty need multiple physiotherapy appointment face-to-face. But after COVID, we're struggling, and often it's just a telephone call, which is not very good. If you have a system of remote monitoring using a motion capture software in the patient's smartphones, supplemented with a step counter, it'll be easy to objectively monitor the progress of the patients. And many patients probably would not need a face-to-face appointment. And also, we can target the physiotherapy for the patients who need, rather than just doing it as a routine. And I think this could also help the patient because they can visually see the improvement in the progression in a chart or figurative manner. And this will help to target the physiotherapy, resource management, and help the patient as well. But even after post-COVID, if provided we get the vaccine, etc., it will be a big resource management usefulness post-COVID as well.
Thank you very, very much, Muthu. In room 30 there. 31, Kirsty Godwin Price.
No. No.
Hans Desmarowit.
Yeah, hello.
Hello.
My challenge is to improve information flow between vascular stakeholders across North Wales. The background, of course, is that the vascular services in North Wales have centralized to Glenclwyd, and we now have to make sure that in the east and the west, all stakeholders, which includes vascular surgeons, which includes podiatry, diabetic services, vascular services, renal services, and of course primary care, read from the same textbook, so to say. Now, my challenge was specifically to use existing services to achieve that. I'm thinking of trust network drives to make clinic letters available. But I also would like some input looking into the future, because the trust employs digitalized electronic records and has a contract with CETO. and Consultant Connect. So how all that integrates in the future to achieve the goal of free information flow amongst vascular stakeholders across North Wales.
Nice, thank you very, very much. Hands in room 32, everybody. Room 33, Angela Jones.
I can't see Angela Jones. Maybe here under another name. There's no Angela Jones listed.
No Angela Jones. Joanna Jordan. 34.
Joanna may be missing in action. Well, this is good news for everyone who's already presented.
Cool. Adele Roberts in 35.
Again, there's no Adele on the call. So if Adele is here by another name, let us know.
And Shane Mills in room 36.
Shane also doesn't seem to be here.
Okay. Have we missed anybody?
Not according to my list, but I am open to be corrected.
Yeah.
You lied.
This is all very good news. I mean, I'm glad we've cut down from 36 challenges. It's a fair bit more manageable, and getting some good quality solutions out there as well. I think as well. I have to say this evening, I think this evening's challenges have probably been a bit more challenging than we picked up in the past. And I think there's some top quality stuff out there, and I'm hopeful that we'll be able to help you find solutions to those challenges, and that we'll be able to find funding and support and resource for you to do that. I think I'm going to pass this over to you now, Emily, in a second, to put people into breakout rooms. I think I need to remind everybody to go to their own breakout rooms, right? You may be sitting there thinking, I heard something very interesting this evening. I'd like to go and talk to them. Can I encourage you to go to your own breakout room first, just in case there's somebody there who wants to talk to you? If you find yourself in a breakout room with a lot of people, by all means move around to somewhere else. Manage your own time. Leave when you feel like it, and or when you found a collaboration, hang around to the very end if you want to. And the very end is likely to be around about 10 o'clock, but generally we will switch it off when everybody's left. So over to you, Emily.
Yeah, thank you. So I will open the rooms in a second. The rooms are named according to the challenge with the number and the name. As Sean said, if your name is Dr. Sam Rice, you will go to room 11. Don't wander off because people are coming to your room to speak with you. Most of you will be able to put yourself in whichever room you choose. I know that some of you will not be able to do that. Do not panic. Once everyone else is in a room, we will come and help you. We won't abandon you. But for everyone else, I'm going to open the rooms. And if you haven't done this before, I will explain how to do it. So at the bottom, you should see breakout rooms. If you can't see it on your screen, click more, and then you will see breakout rooms. Choose whichever room you want to join and go into that room. You're not trapped in that room for the duration. You can come out of that room and go into any other room. So you're free to move around and discuss with everyone and see what's going on. So if you are able to go to a room, and you can see that now, please start choosing and go into the rooms that you want. And as I say, if you are named after a room, obviously that is your room, so please enter that one. So everyone who can, please exit to the breakout rooms now, and everyone else, I will come and help you and find you as we go. And the good news is I've already seen people move into rooms. And don't worry if you want to take a bit of time to go through the chat. So if you look at the chat, everyone is listed there, their name and their challenge. So you can head off into the ones that you need. I can already see people asking for help to get into rooms. I will come and find you and help you. Don't worry. I'm just going to give everyone a few minutes for them to get into your own rooms. Someone is sharing a screen for some reason. Thank you. There we go. So I see some people need help, and that's fine. We will get to you. We have an hour or more left. I'm just going to give everyone else a little bit of time to get into their room. Someone is looking for Kia room number 12. Room number 12, because it was added later, is at the very bottom after room number 36. So scroll to the bottom and you'll find room number 12. It just happens to be out of order. That one is there. I know that some of you cannot see an option to move. I will come and help you. Please stop telling me in the chat. We will move people. If you cannot move into a room, I'm coming to you. We're just letting everyone else find their room and move into those first. You will also see a facilitator in your room. Their name will be facilitator and then their name. They are there just to observe and help you. There we go, so people are still moving. I'll come around and move you into rooms. I know some of you are still asking to be moved into rooms. There we go. Okay, first things first, I will move the people who are here who have presented, who have not gone to a room. So I'm assuming John, Natalie, Sam, you've tried to go into rooms, have you, and enable, or have you not tried?
I don't have any option to.
You don't have an option, but you can see breakout rooms, can you?
No, do I.
You can't see that there are breakout rooms. Okay,
No.
so that's wrong. So can you see a button that says more?
No.
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 You don't have any controls at the bottom of your screen?
I do, but not that one.
You should see one that says breakout rooms.
No.
Okay, let me try and find where you're going then. So I will start with Sam, because I found you. Samantha Shadwick, assigned to. Okay, Sam, has something popped up for you now?
Yeah, it says I'm invited to room.
There we go. We'll do it manually, no worries. And no one panic, we will help everyone. So we will get to you. If you want to go make a little cup of tea and come back, that's fine. We've got at least an hour. There's no massive rush. Natalie, I will put you into your room. Paul.
Thank you.
No problem.
So where do you type which room you want to be in?
I'll put everyone else into the room first, and then ideally I'll probably just do it by talking to you, because I can't explain how many messages I have right now of people wanting to know how Zoom works and stuff, so I will come and help you. Move through, your room's coming to you now. There you go. Molly, are you both going in the same room, or do you want separate rooms? Mooley, can you hear me? Mooley Doddy? I think you're going into separate rooms. I'll assign you anyway.
Emily, it's Natalie here. I haven't moved anywhere yet.
That's all right. Which room do you need to go to?
26.
26. I'll move you now.
Thanks.
Okay. Kia, I'll move you. Does that pop up for you, Robert Kane?
Yeah, I'm in room, supposed to be room 3. Yep.
27, please. Duncan.
27, thank you, Duncan. Carla, I'm moving you now.
Thank you.
Yep. John Paul, I shall move you. Oh, I call you John Paul, like the Pope. Just seemed
That's who I'm named after.
Is it? There you go.
John's Catholic upbringing.
That should be open for you now. Can you see that? There you go. Tom Powell, who's a presenter, should move you. Tom Powell, there you go. Tom's on the phone anyway, he's not listening. Okay. I think that's all the main hands. I know Hans is in the room, he's okay. He's just not entered it yet. Hans, you should be able to enter a room. It's assigned to you already. Are you able to see that?
Yes, I can see the room assignments. I'm just unsure which room to join.
Oh, no problem. You are number 32 for you, Hans.
So should I join my own room?
Yes, because that's where you'll be speaking to people.
Oh, I see. Okay, got it.
No problem. Okay, everyone else, I'm coming to you now. Who have I got on my screen? Matt, which room would you like to go to?
Yes, room 1, please.
Oh, handy, there you go. Off we go. Nicholas Reed, you have a room, don't you? You're a presenter, aren't you? Nicholas. Sign to 13, there you go. Valerie Sparks, where would you like to go? You're on mute, Valerie.
12, please.
Oh, there you go. Open 12 for you now.
Thank you.
We got all the presenters in rooms now, Emily. Just
They should be. I can't see
I
any
think
left.
we do. It looks good.
It looks good. Hans has gone now. Didn't make that clear enough. Cheryl Way, where would you like to go, Cheryl?
Go to room 4, please.
You can indeed. I'll send you there now. Edwina, where can I send you?
27, please.
27. James Norris.
Hiya, number 16, please.
16. There's 2 James Norrises, so I'll send
Both of them.
16
one is also on the call, so both would be great, please.
I've sent both. Joseph Connor, where would you like to go?
12, please.
12.
Oh, Joseph.
Joseph, such a soothing voice. Richard Denson.
Hello, room number 5, please.
Room number 5. Andrew Davis.
12, please.
I keep getting 12s at the bottom. Mark Helmich. I'm going to make a guess.
Helmich, 17, please.
17, did you say?
Yes, please.
17. Cassie?
5, please.
5. There you go. Stefan Gimlet.
22, please.
22.
Oh, Stefan.
Dydig dau. Diolch yn fawr.
Croeso
Hi,
tad.
John.
22 na chi.
Diolch yn fawr.
Alistair Denson.
5, please.
5. Sabana. Oh, you're on mute, sorry.
$12, please. Kia Lewis.
12. That's going to be a busy room, I think.
Oh, I can go to somebody else later.
Okay. Joseph Meerman, how are you?
Hello, could I go to 5, please? I realised there might be 2 of me because Will used my link, so he may be also listed as me.
There is 2 of you. I'll send you both there, then you can fight amongst yourselves. Excellent. Gordon Anderson.
26, please.
26.
I think it's Natalie's room.
Natalie's lovely. Thank you. I'm assuming most other people are facilitators, but if anyone else is waiting to go to a room, please give me a shout.
Hi. Can I go into, hi, could I go into room 15 actually?
15, yeah?
Yeah, thank you.
There now.
Okay, even die start in, please.
Elin, hi, ti'n iawn? Start in. Nice bit.
Hi, Emily. 27, please, if you wouldn't mind.
Hi, James. 27. There you go. Jonathan, are you waiting? You're on mute.
Can I go to room 24, please?
24. Did you say 24?
24. 24.
Yeah, there you go. Brian?
22, please.
22. There you go. Wyn, ti'n iawn? Ti eisiau mynd i'r ola?
30, dwi'n meddwl, Emily, please.
30 mwtw, ie?
Ia. Diolch yn fawr.
Croeso. Is anyone else waiting? Are we all facilitators now?
James Goddard, 28, please.
28. 20.
Sam Wheeler, I can go in room 18, please.
There you go. There's people in every room apart from the ones that didn't pitch, so that's good.
I'm struggling to move, Emily.
What's happening when you try and move?
Nothing.
Can we move you to what room did you say?
27.
27. Yeah. I brought you out and sent you back.
Okay, it's okay, now it's working now.
It's working out. Brilliant. Good stuff. A few people have come back as well. Is everyone where they need to be, or does anyone need to be sent anywhere?
Can I go to 5, please?
I don't have you listed, so it looks like you should be able to move yourself, Valerie.
Oh, I've just come back from 12. Can I go to breakout room?
Does it let you choose one? There we go.
Right, Emily, I'm going to love and leave you now. I'll see you next week. Give us a shout in the week then, just to see how we bring everything together.
Will do.
For next week, yeah?
Perfect.
Have a good evening. Take care,
Thank you.
everyone. Hello,
Bye.
Life Science Hub people. Thanks for working long into the night. See you soon. Take care. Bye.
Excellent. We've got some facilitators now, so I'm going to put you into some rooms. Is there any facilitator with a particular place they want to go?
I go 26, Emily.
26, you can.
Thank you.
You're welcome.
I've been told to follow John, so can I go with him too, please?
You can.
Thank you.
Let's have a look. 26. There you go.
Thank you.
You're welcome. Beth, ti eisiau mynd i rola?
Anywhere I'm needed, Emily?
Anywhere. Let's have a look. Lle sydd angen facilitator. Oh, Pederi, neu di mynd i room 1, please? Diolch. Pederi gwybod pam. Beth, ti eisiau mynd i room 3, mon 2 sy'n na, so jyst i checio bod nhw'n iawn.
Yeah, great.
Thank you. Sandra, are you waiting to be put anywhere?
Number 10, please.
You should be. Oh no, you shouldn't. Sorry, I was going to lie to you. I have to put you there. There you go. Tom Powell, isn't it? There you go.
Thank you.
Cool. Is there anyone else who's waiting that I'm ignoring as I put the facilitators in?
Emily, I can't seem to be able to navigate into other rooms because I've got the icon now. It says join breakout.
Yeah.
It just takes me back to where I've come from to 12, and I want to go to 5.
Okay.
I don't know how to switch between the rooms.
It's showing you in room 5, but it says not join, so you should have the link to join with you. So if you go to the bottom and click on breakout room, there should be something there that says to join room 5. I'm going to assume she's gone. Yeah. Matt?
Hi, Emily. Yes, I've managed to get to a room, but I can't get to another one. Just wonder if I can go to room 24.
You can indeed. Room 24 should be open for you.
Great.
Anyone else? There's a few people on mute. So I've assumed are facilitators, but may just be listening and taking a break. Jamie, ti fancy mynd i'r o'r?
Send me anywhere, dwi'n mynd i.
Lle sydd ddim efo facility. Mae'r cash yn gwybod beth mae'n neud, mae'n fine. Yn y rŵm yna, mae'r facility yn fanna. Na, mae'n chdi rŵm 15, Dave Smith am wan. Gweld maen nhw'n neud ydyn, os maen nhw'n iawn, sydd allan am ei ffeindio rôl arall. Diolch.
Iawn.
Hi, Emily. That room 24 didn't work, I'm afraid.
Didn't work.
No.
Okay, so you should have a link. It's saying that you're assigned to the room, but you're not in the room. So if you click on breakout rooms at the bottom, it should...
The bottom of where?
So at the bottom of your screen, if you move your arrow, it should say breakout rooms in the bottom panel that comes up.
I've got it now.
Lovely.
Great, thank you.
How huge is it?
Hello.
Hi, how's it going?
Okay.
Yeah, good, thanks.
That took a lot less time than last time, I have to say.
Yeah, that seemed good. I think it looked about 50 people went automatically, and then it's that this phase now between people's software getting up to date in Zoom, and I think give it another month or two, and that'll probably be standard.
Yeah.
It'll definitely be much easier than last time. I think it took like 25 minutes.
Great stuff. And have you had good pictures? Sorry, I had to pop in and to see my students in the hospital. They're doing night shifts for the first time ever. So,
No problem. Do you want to go into a room, Chris? Or
hey,
you want to go into a room?
do you want to send me to an interesting room, Emily?
What would you like? What themes do you like?
What are the themes?
So I pasted them in the chat, but let me have a look what might interest you.
You know what I normally do, isn't it? So.
Yeah. There was one AI one, but I don't think they came. And there's one weirdly that I think might interest you, which is someone wants to measure urine output, which apparently no one does.
Yeah, urine output is extraordinarily badly done. Did I tell you about this tiny project that we did? We had some help from the Royal College of Art. We had a designer employed for a year. And we came up with these little wee bracelets that had different colors of yellow on them, and the patient would tell the nurse what color of they peed. It increased the amount of urine that people passed within 24 hours by a factor of 3. Nurses started to actually record the stuff meticulously.
That's amazing.
Yeah, so ping me to a nice room.
Someone just told me that they're working on robotics in one room, so that'll be a good one for you, I think.
Sounds about right.
I'll put you there, which is room 50. Is it 15? Oh, what room is? Hang on, let me just check what room someone's in, because what room are you in? I've lost him. Oh, there we go. Room 5. I'll move you to that one. 5.
Ta.
Just move on to 11. There's some really popular rooms, and then there's some with like 2 people in. I feel bad for them. At least there's someone in every room, so it's not too bad. And now it's just a waiting game. I feel like Billy No Mates. So at least there's people here. Last time it was just me sitting here, and occasionally someone would come in and go 5, and I just move them like bingo. I'd just be like, okay.
Emily, I just popped you a note as a reminder for facilitators who in the bluster of their rooms now people might form teams very quickly and forget. And I wondered if not straight away, but perhaps shortly, you might do a broadcast to the rooms.
No worries, I will do that.
Just to remind people, and again, if people get stuck then and say, "Oh, I don't know how to do it," then I can pop in and sort them out.
No problem. Cool. So far, so good.
Brilliant pictures.
They were so good, weren't they? Everyone was basically dead on 1 minute, straight off the bat.
Topics, quality, range, like all sorts of different people, different fields, different health boards. Not health boards. Public Health Wales. Just
amazing.
Absolutely brilliant. Absolutely brilliant.
think this might be one of the best we've had so far. Arif, do you want to go into any rooms or anything?
Hi, no, I'm okay. I'm just trying to figure out which room to go into next.
No worries. Take your
I can't
time.
decide. There's too many good ones.
They're all good, aren't they? I know. So now, Wayne. It's on mute.
Sorry. Then automatically mute chi pan ti'n dod allan o'r breakout rooms. Okay. Technology, de. Please, symall 17 os gai.
Lle ti newydd ddod o? Chos fyddwch chi dal yma.
30.
30.
Emily.
Wyn. Hi, I'll move you in a second. I'm just moving Wyn, sorry. Dennis Lee, Wyn, 30.
Mynd i 17, ia. A di dod o 30.
Na fo. Joseph, how can I help you?
Could you stick me with Mr. Powell, please? That would be very kind.
Where are you now? So I can. Oh, I found you. And you would like to go to 10. There you go.
Thank you.
Hello. Jackie, are you okay? Oh, you're on mute, sorry. You're on mute, Jackie, I'm afraid.
I'm doing a little round robin because nobody's joining me, so I'm going elsewhere.
Where do you fancy joining?
Well, you know what? I'm going to join them instead, so that's okay. That's perfect.
Oh, okay. Oh, yeah, you can join your own rooms, can't you?
Yeah, thank you.
Lovely, thank you.
Sorry, lovely. I seem to be still not with Mr. Powell.
Mr. Powell's in room 10. I can't find you anywhere now. That's helpful, isn't it?
And Wyn's still here.
Dwi dal yma. Just disgwyl cyfle.
O, fair Federi, un ar y tro.
Ti'n iawn, Wyn?
Dwi'n rhaid da, diolch.
It says that you're in room 10, Joseph. That's where you wanted to go, isn't it?
Wherever Mr. Powell is. If he's
Yeah,
in
room 10. So you should be able to go there yourself. It might not pop up. So if you go to breakout room and click, it should be open now. So you should be able to
Join
just...
breakout room. Oh, thank you.
That's all right.
Thank you, Emily. Bye.
Wyn, lle ddech chi eisiau mynd?
I 17, beth.
Yeah, so os ti jyst yn clicio'r breakout room, ti'n gallu clicio hwnna dy hun a mynd i fewn i fan'na. Neu jyst yn popio fyny tro ma.
Sorry, mae bottom yna wan, sorry. Diolch.
Dwi'n iawn, Federi?
Ynddo, diolch.
Dwi'n iawn, dwi.
Da iawn, chwarae teg, yndi. Very good.
Cool, dwi'n mynd i cymryd comfort break tas. Mae rhywun yn dod i fewn yn panicio, neu dwi'n dweithio na fydd yn ôl mewn 2 funud.
Na watch yna aros ar gad. Hi everyone. Emily's gone for a comfort break, so I'm just been told just to stay here and make everyone aware that she'll be back in a minute. If you've been to a breakout room and you want to change it, you may be able to change it yourself. There's a little button now that you'll be able to see in the bottom. You may be able to change it yourself. Otherwise, you'll have to wait for Emily to come back. She's just having a comfort break.
Sorry.
There you go. She's
All right.
back.
Who needs to go where? You're on mute. Sorry, you're going back on mute. So take yourself off that so I can hear you.
You're still on mute.
Oh God, sorry. Hang on, it's all happening. Right. Hang on a second. I've lost my room because I'm in the process of that. Oh, I know. I wanted to go into Nick Rood's room.
That's room 13. There you go. So that's now. If you just click on breakout rooms at the bottom, you'll be able to go to.
Perfect. Thank you very much.
Thank you. So now
Dwi'n ôl, maen nhw jyst yn trafod. So rhywun arall angen help?
Dwi'n meddwl pawb yn oce, really. So neb i fod yn dod mewn ag allan o'r rooms.
Oedd y rŵm ti y weld yn ffain hefyd, oedden nhw weld oedd sorted.
Mae lot o hyn wedi bod yn y hack dwytha fyd, dwi'n nabod lot o'r enwau gwynebau, so dwi'n meddwl mae lot o nhw'n get it.
Yr unig beth oedd o ddim wedi dallt o bod nhw'n gallu iwsio Simply Do fel i cael ymlaen y sgwrs wedyn, nes i troi egluro bod oedd platform wedyn hefyd.
Oedd Sean ddim isio ni fatha advertisio hynna, chos oedd o'n melissa fatha, fydd hynna rhy confusing i pawb, ond dwi a Jonathan di secretly decided ydy ddim rhy confusing, a da ni'n mynd i ddeitha pawb, gewch chi jyst cael ymlaen.
Eisiau dweud, grewch WhatsApp grŵp neu e-mail grŵp, neu disawch ar Simply Do website a cael ymlaen y sgwrs yma yna, so...
Mae hollol fyny nhw sy'n mynd nhw'n neud o i li, dydy. Ond mae'r un wedi cychwyn yn barod cael y chats na ar Simply Do.
Ai, sign off i Emily gael mynd i gwely, ia?
Puddle hoons.
So faint, ti'n meddwl, bech os ydych chi'n gallu jyst agor bob un rŵm, mae pawb gallu newid eu hunan, de?
Ie. Mae rei yn o natia 50 jyst mynd yn syth, de. Pardon?
Gadael y call?
Na, mynd i mewn i rooms y hunan yn syth, de.
Pan bod rei'n gallu reid a rei ddim, ta?
Dwi'n heb update o Zoom. Ti'n gorau gael, da ni ar version 15 o Zoom, a ti'n gorau gael version 13, ne, mwy newydd.
Ond dwi efo'r opsiwn rwan i ddewis breakout room, do'n i ddim tro cynta. So ar ôl bod ynny'n, dwi efo'r opsiwn. God knows why.
I rei pobl, chos pan nes i gael o tro cynta, a ni'n gorau wneud o 3 gwaith cyn i Zoom sylwi ddim yn cael wneud o. So weithiau sy'n rhaid yn wneud o ddim. Ond mae rei pobl fatha, ddim efo'r fersiwn iawn.
Dwi'n meddwl bod fi version iawn, felly. Version 5.
Hi Emily, gai fynd i stafell 30 gen ti?
Ceithad, 30, na chdi. So, dylse fo hwnna, os yn llwy'r rooms ar y gwylod, fe chdi'n gallu gweld hwnna i fynd i fewn. Cool.
Pam ti'n cael rhywun fatha Dr Elin Davies yna fo, ti'n gwybod ti'n hitio pobl da, really da wedyn de.
Watchad ti, Bobby Williams.
O, oedden ni wedi gofyn o joinio.
Fi ti fod am di aros, le?
Be nath o mynd i breakout room na'n byd? Well, you can take a horse to water, yeah? Hey boys, dwi am fynd os na da chi angen fi gymaint yna. Dyna'n iawn. Cos eich di fod yma dan am awr arall dys yn hyn?
Ie. That's the gig. Nos da.
Yna tebyg. Edd oedd yn ôl rhyw hanner awr i checio sydd yn mynd ymlaen iawn.
Oce, da.
Ta Beth.
Ta! Ti'n iawn, Emily? Ti angen help efo beth?
Dwi'n meddwl da ni'n iawn. Mae mam edrych oedd am na pobl yn chatio ag ati, so.
Di o'n neud Movember?
Ne.
Ie, o'n i'n eisiau gofyn, ond o'n i'n...
Dwi'n gwybod na oedd o, chos oedd o efo fatha masasiol fel ar fan ma, fatha Spanish style, ac na oedd o bod ar BBC Cymru, heddiw neu whatever, gael ei ffilmio, ac oedd o'n eitha, just siarad beth yna ar rhywbeth.
O'n i'n meddwl allan bod o'n gael bach o crisis. Ond dwi fel...
Efo moustache.
Yeah, the Covid crisis. Wel, os oes am byd allai wneud, dwi wedi wneud yr tweetio, it's all done. Fyddai nôl nos fel i wneud mwy. Ond, just rho shout os ti angen o beth os yma.
Mae yna dipyn yn ystafell 5, de. Ti'n mynd jyst rhaid am 2 funud, jyst i chdi adael nhw bod before you go, remember to change details.
Absolutely fine. Go for it. That's what I'm here for.
Thank you, Beth.
Iawn, boi.
Diolch. Hiya, Dave, you okay?
Yes, I am, and I don't actually know where I'm going next.
That's all right. Take your time, have a look.
Thank you.
You're on mute.
Hi, Emily.
Hiya.
Hi, could you put me to what was it? There are two I wanted to see. Carla Blee. Carla Blee.
Yeah, I'll send you that one now.
Thanks.
I got in.
Hi,
Oh, he froze at the crucial moment.
It's just gone. Andrew, are you okay?
Can you put me into Duncan in 27, please?
27, I can indeed.
Thanks.
If it doesn't pop up, you might need to click breakout rooms at the bottom and then you can find it.
Ah, great. Yeah, it's back. It's there now. Yeah, thank you.
Sabana, the same for you. It might not pop up. You might need to click. Oh, there we go. Hi, Melissa. Are you okay? Oh, hang on a minute. Ned. My dog's just sticking his way through the sofa there. You're on mute, Melissa.
Look.
Oh, who's that?
Disney. Ugliest dog in the world. Look.
Oh, I can hear you.
Hey, listen to this. I've just been in a room with Reese and James Goddard.
Yeah.
Because we've been trying to support Reese, in the last couple of weeks because there's a few barriers to him really and getting what he wants, whatever. He's just told me, and I think it's really good feedback. Although there isn't a solution, or the solution that he wanted isn't available because of bigger variables, he's managed to make more progress on his challenge in the last 3 to 4 weeks, quote, than in the last 3 to 4 years.
Wow.
That is, you know Reese anyway, don't you?
Yeah.
Are you one of twins?
Yes.
Yeah, you were saying you're a twin. But yeah, now, okay, so there's not a boxed off solution. However, because of Joanna and James, he's getting embedded in some of the groups that we can look at the communication strand. But to hear someone say, well, in 3 to 4 weeks, I've made more progress than 3 to 4 years, I think that's phenomenal.
That's amazing. Why is that then? Because he got the interaction with people and...
Because Joanna was able to tell him, actually, because of where we are, what wouldn't be possible.
Okay.
Then because there was then he's been able to say, well, he could take a 2-prong approach. And on the other prong, it's about Joanna and James being able to tell him what the all Wales mechanisms are.
Yeah.
And yes, there's not going to be an innovation that comes out of it that's going to commercialise. However, there is hopefully going to be a change that comes out of it that will benefit a hell of a lot of patients.
Perfect.
And that's what it's all about, isn't it, at the end of the day?
Exactly.
But we wouldn't capture that, Emily.
Yeah.
We'd miss that.
Yeah. But it's good to hear, and it's good to think that even though not everyone is going to come on and pitch, they are getting something out of it, and it's
absolutely. And I think somehow we also need to sort of think how we capture that sort of information, because otherwise, I think I'm going to put my camera off. Hang on, only because it's flickering like mad. Have I gone?
Yes.
Oh, I just think that otherwise we're losing some of the real value.
Yeah.
It's not just about the solutions, it's about the talking shop.
Yeah.
And I was really glad that Sean put the bit in tonight about, look, lots of people are going to get in contact with you. They're only wanting to help.
Yeah.
Don't get yourself all in a kerfuffle over about, it's fine. I think that's
I do listen to you, Melissa.
Oh, no. Oh, sorry, I didn't know you were there, Sean. Sorry, but that was fantastic, Sean.
Henrietta, where do you want to go? Are you looking to move to a room?
Who?
Oh, sorry, Henrietta has just come back.
Yeah, sorry, I'm just looking about which one I want to go to next. Sorry, bear with me.
No worries. I think, Melissa, maybe when we send the
back
email...
there as well. Oh, no, he's gone again.
He's gone back into his room. No,
like little hermits. Little
Can I
hermit
go into
crabs.
12?
you can indeed.
Thanks.
So,
No, I do think we need to capture some of this other stuff of value. I do.
I think maybe when I send the email saying, please can you confirm if you're going to come and pitch, we'll just ask people, if you're not pitching, what was the value you got, or we'll phrase it.
Yeah, yeah. I mean, I admit I've been a bit conspicuous by my absence and haven't put a lot of work into the last couple of weeks, but I've been preoccupied with other stuff that I had deadlines on. But I think for all the people that have put so much work into it, to hear about that added value is massively important.
Yeah, definitely. Definitely. I think it'll be encouraging for people to hear, you know, all the different stories that come out of it, not just Texas won 20k or whatever.
Yeah, exactly, exactly. I mean, to hear, for Reese to just say that to me now, I just think, wow, that just blows my mind.
Yeah, that's brilliant, isn't it?
Who's that now?
That was Gwilym, who was on the call, but Reese.
All right, yeah. Do you know Lisa Williams, right? I didn't throw numbers around because I didn't want to talk too much about things, right? But Lisa Williams, who didn't win last time, right?
Yeah.
She went off looking for funding from Welsh Government and various other places. She worked all over the summer with her industry collaborator who put in all the time for nothing to help her out, right? And they got £250,000 to spend on their solution development.
God,
I swear, right? You wouldn't believe it.
You know what? It is for all the messing about with these sort of events, and I know it's hard, and I know I haven't done any messing about. I've been messing about with the Health Foundation bid instead. But it is just hearing that off Reese tonight.
Yeah.
You just think, wow, I'm so happy. I will go to bed so happy that this has catalyzed somebody who has really struggled with this, feeling he's made such progress, even though it's not the solution he was after.
Yeah.
And that James, I've never met him before. James Goddard, I think he's called. He's somebody from M-SParc and informatics.
Oh yeah.
By Joanna Dundon, but he's been so supportive. Fantastic.
That's good, isn't it?
Oh, I'm dead chuffed. I'm dead chuffed.
And I've been marking as well. I've marked all in yellow on my paper, all the ones that they've had people in their room talking all night. And I think there's about 15.
Wow.
So it's also starting to look, it's good, but it's also more manageable than what we worried it would be.
Yeah. Yeah.
20 odd, so.
Hey, did Rakesh get anyone going into him, Emily? I went in a couple of times and he was by himself.
No, he did. He's got 3 in there with him now.
Oh, that's all right.
Am I right to think that there's about 10 people in the room with Rob Letchford?
Yes, people love Rob Letchford's one. What was Rob's one?
Rob Letchford?
Rob was technology, mobility and rehabilitation.
Oh, yeah.
But I'd say like most of the people who asked me to sign them wanted to go to that room. Or Tom Powell's one's been popular, and Sam Rice. Carson Aikman as well is a really popular one.
Yes, I was going to go in and see how. I don't know him, at all, even though he's Betsy and he's in the hospital as me. I was going to pop in and see him, but then I needed to just see if Reese was all right. But
William is on his own at the moment.
Who?
William.
Yeah, that's Reese. It's the same person.
Or Reese. What does he call himself?
Reese.
Reese.
He's going to go off in a minute because I said his conversations are going to happen outside this now, I think.
Yeah.
I know Ellen from Aparito's been in contact.
Hello, Ellen. Do you know?
Just as he said her name, she popped in. It's like you summoned her there.
Hello. Hi, Ellen.
Gordon, I'm opening room 33 for you now. That's open for you now. Hi, Ellen. We can't hear you. You're not on mute, but I can't hear you. That's weird. Sabana. Do you want to unmute yourself and tell me what room you'd like?
So I'm gonna take a room soon, but I'm not sure where to go yet.
Can you hear me, or am I still muted?
No, I can hear you.
Okay, right. I'd like to go to Samantha Chadwick, please, number 6.
Which one are you in at the moment? I can't seem to find you.
I was in number 4.
Oh, there you are. And where did you say, sorry?
And number 6.
Number 6, there you go.
Thank you very much.
No problem. Gordon, you should have.
Hi, yeah. There was nobody in 33.
Oh.
it was I was on my own. Number, let me see. I was just looking at one now. I would like to join. Number 9, please.
Let me just check before I send you that.
Is anybody there?
9. There is actually no one in 9.
No one in 9.
Oh.
I'm just clearing out the rooms, obviously. Everywhere I want to go, they run first.
Sorry, Emily. I wanted to go to 16, not 6.
Oh, sorry.
No, it's my fault.
There you go.
Thanks.
Sorry, Gordon, where did you say you wanted?
Rooms 6, 7, and 8 seem to be together. Is that correct?
Yes, there's 3 challenges there.
Ah.
But it's the top that's using on them all.
So I'm probably more on the dementia side. So if one of those rooms is the reminder alarm for dementia.
Yes, it is. I'll send you in there now.
Thank you.
Reit, dwi'n ôl. Dwi wedi rhaid Gordon yn ystafell yna, achos mae o'n dan defnyddio AI i wneud remote monitoring, so mae o'n good facilitator i gael. Mae o'n troi mewn i chi bach o sales pitch, so dwi'n gobeithio fedrwn ni symud yr wrth hynna.
Dwi'n broadcast am hwnna.
Be, sorry?
Dwi'n gwneud broadcast i hwnna, fydda rhoi neges yn dweud, please don't come and sell something that exists. Remember you.
Mae'n, dwi'n meddwl mae'n troi mewn i chdi bach o hynna. Ond dwi'n kind of gobeithio fedrith Gordon symud fo yr wrth hynna, achos mae gen i fo'r expertise mewn AI a remote monitoring. So, dyna pam nes i ofyn fo joinio. Ydw i angen mynd i'r stafell oedd o'n? Dwi'n meddwl bod fi.
Dwi'n meddwl mae pawb probably'n oce, dwi'n wan sy'n ei ddeud.
Gwych. Reit, dwi'n mynd i fynd ta. Dwi'n mynd i ddal bake-off ar +1.
Nice.
WhatsApp efo ti angen rhywbeth o.
Lovely, diolch e.
Diolch chdi. Tra. Bye everyone.
Hi Molly, you're on mute, Molly. Oh, there you go. You okay?
I'm glad you got me to stay, mate.
Emily?
Hiya.
Yeah, I don't know if it's still going. Could you put me in 27?
Yeah, there's people there. Which one are you moving from? Sorry, so I can find you.
Moving from 5.
Moving from 5. 27. There you go. That one's open for you now.
Okay, thanks, Emily.
No problem. Stefan? Hi, Pascal. Oh, you're on mute, sorry.
Hi, sorry. I was in a room and then
my mom kept calling on the like I couldn't talk, so I had to go out and answer. Otherwise, it would have been no storm. So I was trying to. Actually, can I ask Emily? Basically, a few people we exchanged emails over the different chats. So now I'm on an iPad. The problem is I cannot see them anymore. So I didn't write them down.
I can either send you back into the rooms to talk to them, or their emails should also be collaborating on the Simply Do platform. So it's up to you. Probably best to go back into the room and see them.
No, the problem is some people came into my room and then they went somewhere else. So they are.
They can find you by going on the platform again. So that should be okay.
Okay, so yeah, I will go on the platform and yeah, perfect. I remember the names at least. So it's great. So thank you very much for organizing it. So will we hear by email kind of the outcome of today?
Yeah, so what we'll do is we'll give you a couple of days for everyone to talk to each other and see if they want to collaborate with anyone, and then we'll email you asking how things are going, if we can help, or if you know that you definitely want to pitch, and then we'll go from there.
Okay, perfect. So just because with the clinical work is always for me evening or kind of unsocial times. So yeah, just wanted to make sure that I wasn't missing. That's great. Thank you very much, Amy, for organizing, and take care. And maybe see you next week. Anyway.
Thank you. Good night.
Good night. Bye.
Andrew, are you okay?
Is room 26 still there?
Actually, I go to room 1 just in case there's someone else.
Yes, I will move you to 26 now. 26. There you go.
Brilliant. Thank you.
Who else do we have? David, can I move you there?
Oh, I can see the breakout rooms button now. It's appeared.
Yeah, so for some people it has. Like they've gone to one and then see it. So that's been.
It'll only allow me to go back into room 11 now.
Where do you want to go, Joseph?
I'm just having a look at the list now.
Okay. Anyone else? Let me know where you want me to move you to.
Can I go to room 13, please, Emily?
You can. Where are you now, so I can find you?
I've just come out of room 4. I'm in the main room now.
Room 4, and you want to go to 13, did you say?
Yeah, I was in 4, but I'm in the main room now. I left room 4, but I didn't know how to get to room 13.
So you should be able to go to the bottom bar and click breakout room, and now it should say join.
I haven't got breakout rooms on my bottom bar.
Oh. Are you able to see something that says to let you in? Should be something. It doesn't. It says more, and then you can click breakout rooms.
I click more. Oh, actually, yes.
Only I didn't have it either, Emily. Then all of a sudden, it's just shown up.
How weird. Oh. Do you want to go anywhere, James?
I do. I'm just trying to work out where.
No problem. David,
is there?
Oh, God. There you go.
I was just wondering if there are many people in, which number is it? Room 5? Is that busy or not?
Room 5 is the busiest room.
Oh gosh, okay, maybe not then. I did want to talk to him, but never mind. What was the other one? So, 15 was the other one you said. Are there many people in there, or is that quiet?
There's only Dave in that one, so I will move into that one.
Ah, yes.
There you go.
So I click. Ah, there we go. Yeah, I've been. The button now only takes me to 15. Perfect. Cheers.
You're welcome. Hi, Hans. You okay? You're on mute, by the way.
Hi, Emily, it's Carsten here. Can you hear me?
I can hear you, Carsten. Yes.
Yeah. Anything else we need to do tonight? We have sort of finished in the breakout room.
Nope, that's it. Just make sure you've got the contact details of anyone that you need. And then everyone will also still be on the Simply Do platform. So if there's anyone you want to connect with, you can go back to that website and connect with people on there as well.
Okay, right, yeah, that's great. Thanks a lot, then.
Thank you.
Great event. Loved
Brilliant.
it.
Thank
Okay,
you.
bye.
Bye. Hans, you're on mute. I'm not sure if you're talking to us or not.
Oh, I'll take my leave as well. I've had 8 hours of clinical governance meeting today, but this was a very interesting experience meeting so many people from different backgrounds online.
Oh, brilliant. Thank you, Hans. And as I
Thank
said to
you.
the others, remember you can go on the website and connect with people anytime for the next few weeks. So
Okay,
brilliant.
lovely. Thank you.
Thanks, Hans. Good night.
Good night.
Okay, Emily. How do you switch to a different breakout room? I've got the breakout room button, but it's just wanted to put me back where I was.
Some people can't for some reason, so I will switch you. Which room have you just left? Because you'll still be in that one.
I've just left 27.
27, yeah. And where would you like to go?
And I was heading to, is this skin cancer chap on 15? Ian, is it?
No.
CTM.
Where is he?
He's a CTM skin cancer chap.
John Wells, 24.
24. Is the one,
Oh,
yeah.
yeah.
Thanks, Emily.
No problem.
I'm amazed how this has come off, actually. Well done.
Thank you. So now when you click on the room, you should have 24 there to do.
Didn't work the very first time you did it. Can you try and do it again?
So it tells me that you're on it. So if you click on rooms again, the one that lets you join should only be 24.
Oh, yeah.
Lovely.
Hi Emily.
Hi, Edith. Iawn?
Iawn, diolch chi dde.
Iawn, diolch yn fawr.
Dwi'n gael llawer o ddiddordeb, so dwi am mynd i gael te.
No, fair enough. Diolch am hynny.
Ocê.
So hynna na.
Da, chwarae teg. Iawn, diolch yn fawr.
Iawn, hwyl.
Hwyl draw.
Hi, Alexander. You okay?
Hello. I assume we're finished now, right?
Yeah, if your room's empty and you don't want to go and join any others, then you're done.
Brilliant.
How
It was
was
very
it?
good today. I enjoyed it.
Oh, brilliant.
Yeah. Got some contacts from Swansea University and Accelerate, the Welsh Accelerate. There was also an engineer, so definitely somebody who's got that type of experience.
Oh, brilliant.
Things that I don't have. So yeah, it's looking promising. Do we have to make a presentation now for next week, or how do we go about presenting this?
So what we'll do is we'll email you in the week and see how you're doing, and if you want to pitch, and if you do, you just let us know and we'll book you a slot. And it's just the same sort of format as today, but you'll have 3 minutes to do your pitch, and then you'll get
3
questions from the panel. But we'll let you know all that via email and everything.
Can we have like a PowerPoint, for instance, to present, or?
Yeah.
Okay, cool, excellent. I thought there was as much. So brilliant. Anyway, thank you very much. Have a good night.
And you too. Thank you. Good night.
All the best. Thank you for the opportunity.
You're welcome. Thank you, Jamie.
Bye.
Hi, Richard. You okay?
Yeah, just getting my head around the whole thing. It seems I wasn't fully prepped in terms of what exactly the kind of dynamic was going to be in the meetings, but yes, it's been interesting.
There's a lot to take in, isn't it? It's quite intense.
Yeah, I was interested in room 2. I think it's the sort of triaging.
Unfortunately, no one has gone to Alison's room, so she's left. But if you want to catch up with her, if you go onto the website, the Health Hack website, her challenge will still be there active, and you can still communicate with her via that if you want to get in touch.
I can't seem to see anything on the website. I can get onto the website, but I can't see any challenges or solutions.
Here is the mental help. Joseph, I will leave you to speak to Richard. I'm going to room 27 to help someone. I will be back in a second.
Yeah, no problem at all.
Might be. I didn't register properly, so I used a different link, which may be the problem.
Oh, no problem. Let me have a look for you. Just a second. I'll log in myself here. Richard.
Is this a new Zoom feature?
Say again, sorry.
This ability to do breakout rooms, is that a new Zoom feature?
No, I mean, the breakout room itself is not a new feature, but the new feature that Emily's deployed this evening is being able to free choice your way into different rooms, which is still relatively new and is still sort of, I think, going through a bit of an update in Zoom. But it's really handy. It's really, really handy.
The only thing I've done similar in the past is Adobe Connect, which allows you to do kind of remote training and then like go into breakout rooms, but this is obviously cooler.
So I've got you in here as Richard Denton. That's right, isn't it? And it's tequilaautomation.com.
Yes.
Super stuff. So
you're cross you for 2 seconds to just ask Duncan which room he needs to go to.
Please, yeah.
Where would you like to go, Duncan?
Number 5, please.
Number 5. I will move you there now.
If they're still there.
Number 5.
Yeah, that's my.
Yes, that's the busiest room. I will move you there now.
Thank you.
You'll just need to click at the bottom where it says breakout rooms and then click join and it'll take you to 5.
Yeah, lovely, thanks.
Lovely. Sorry about that, guys. Carry on.
That's all right. And then which challenge was it that you were interested in, Richard?
2 and 5.
And 2 and 5, Emily. Which ones were those? Was it Rob? Was auto triage one of them?
2 was Alison Bishop, which was measuring home care. Oh, Alison didn't pitch, so you mean room 3, the second one, sorry, yes, which is Robert Kane, auto triage. Is Robert there? I don't think so. Robert is, it says Robert's in the room alone. I don't know if he will be there, but I can try and move you.
He's
just
about to leave, so BB
really quickly. Go and try and catch him. So if you click rooms at the bottom, you should be able to click him and join it. At present, he's still there.
Yeah, thanks.
Lovely, thank you.
Sorry, I just got out of a room with him actually, so I thought I'd get you in there quick.
That's all right, thank you.
Emily, I'll pop Richard Denton then. I'll pop him specific links to those challenges for Alison and Rob. So if he does miss them, he can just follow that link and it'll take him straight there and he can get in touch with them from there then.
No worries. Cool. We've had a couple come back in and say that they're going, but that they've had a good time out of it. So people seem to already be kind of collaborating, which is good.
Yeah, I've just been somewhere else. I've just been to check on another one. They're not going to come back and pitch next week in all probability because they've found it. There's probably not a sort of commercial solution at the moment, but they've made contacts here that is going to enable them to get their irons in the fire for making progress with things that are very important around patient care. So a similar sort of thing as Reese, really.
Okay.
And that's Carla. So as I say, she probably won't come back next week, but is absolutely elated with what she's found out here this evening.
Oh, that's good. That's perfect, isn't it? As long as people are getting something out of it, it doesn't necessarily matter if it's not what we thought they would get out of it.
Overjoyed.
Oh, brilliant.
That, you know, how useful it's been.
Oh, good stuff. Hi, Sabana, are you okay?
I thought before leaving, I'd like to go to another room, please.
Yes, of course. So would you like to do?
Number 14, please.
No one. Oh, Molly's here.
Molly. Oh,
Molly,
hi,
can you
Molly.
go back into your room and I will send Savannah to you, please. I'll send you to Molly's room and I will try and send Molly there as well. Molly, can you hear us? Can Molly hear us? Yeah, there we go. He's got the notification.
I tell you what, mate. I'm going to take a picture. Right, everybody smile, right?
Alistair, can I send you into room 22? Savita's asking for help.
Sure, go ahead.
There you go.
How many people do you think we still got on? I was having a look now. There must be about 50 people still around easily.
4, 5, 6, 7, 8, 53, 54, 55, 56, 57.
That's brilliant, isn't it?
Isn't it?
That is really good. This is the best one yet. I'm loving it.
It's very good.
Everywhere I'm going, people are going, they're getting great value out of it. When are you asking them to let you know if they're going to pitch next week, Emily? When?
What I've said is that I will email them all in a couple of days.
Yeah.
To ask them if they think they're going to pitch or not, and then we can weed out quite a few of them then, I think, and then we'll keep in touch with the rest.
Brilliant, because then they can get a better time, can't they?
Yeah. So a lot of them have come back in here before leaving, and I've told them if they've lost anyone, they can go on the website and find them, and we'll email them and see where they are. So they're all quite confident, I think.
You know, when you look at the breakout rooms, how can you tell if there's still somebody in there?
I don't know if you can see what I can see. I can see a list of everybody who's in each room.
Okay.
Yeah, I can see that too.
I can't.
Hi, Carla.
Oh, shut up. I keep just popping in and out. But it's like, do you remember Rent a Ghost? It's a bit like being Rent a Ghost.
Yes.
It was good.
Yes,
I used to love.
Yes, Melissa.
Yeah. Get up, Sean. Just because you've managed to say something right tonight, don't get carried away.
I need to get my beer a little bit bigger. I used to enjoy pretending to be whatever his name was, sitting on top of cabinets.
Yes,
in workshops. That's good fun. Sitting on cabinets in workshops wearing pink hats, right? Can you imagine anything more stupid?
Wonderful. Life needs a bit of absurdity, Sean.
What are you talking about?
It was before your time, darling.
It's a children's television program.
It was hell of a good.
Yeah, look at that. Rent a Ghost. You love it.
Rent a Ghost. Do you remember the theme tune, Sean?
No.
It keeps coming into my head and then going again. But that's what this going in and out the breakout rooms reminds me of. I love it. I love putting my camera and my video off and then just sneaking in and having a listen and then coming out again. So interesting. Duncan Forbes.
Emily.
Hello.
I'm going to bid everybody a farewell, good evening and good night. I've been on this screen in lots of meetings all day and my eyes are going, I can't see really very well now. Sean, I just love your enthusiasm. Oh, see, Andrew's following me. I love your enthusiasm and I love the fact that you've got a hat on. So, so can I just clarify next steps? Because obviously, will that come through on the health hack itself?
Yeah, so there'll be two ways. You can go on the actual platform to keep collaborating with people on the website, and we'll also email you directly in a couple of days just to ask how things are going, if you want to pitch or if you need further help with anything else.
Okay, perfect. Lovely. Thanks ever so much.
That's all right. Thank you, Jackie.
I love the pink hat. You've made me smile tonight. Thank you very much. And love the music when we joined. Andrew, I'm actually going home now.
You go home, please.
I'm going home.
Actually going home.
Don't put feet up.
Good night, everybody.
Ta-ra.
Bye.
Thanks, Jackie.
Bye.
Emily, is anyone in room 30 or is that empty and gone, finished?
Let me have a look for you. No, no one's in 30, I'm afraid.
Okay, no problem. It's late. All right. Well, thank you very much. I will leave you to it as well.
Thank you, Andrew.
Yes, Sean. Thank you.
Bye.
Bye. Bye.
Emily, it's Savita here. Hi, I just wanted to know, there's a lady called Sarah Gray whose idea was very good. It kind of matched my other idea about the patient's cancer journey, perhaps through an app. Was she part of the?
No, she didn't turn up. So the best way to get in touch with her probably is back through the website or the Simply Do platform. She should still be checking that, and she'll get a notification if you comment on it as well.
Okay. Thank you.
Thank you.
Right. Thank you, Joseph, Emily, and Sean. It's been a lovely session and really, really useful networking opportunity. So I'm going to go and have a think about how I proceed now and fill all the boxes that you asked me to fill in this in the health hack, but on the health hack side.
Did you get? Have you got what you needed, Sarita?
I did. I found somebody who's actually kind of built an app which I can tag on to. So
cool.
Sounds like a good solution. I just need to work out what bits I need from it and how I go about doing it and how much money we are going to need to build the next bit. So I think those are the questions.
Are you coming
Sean.
back next week to present?
Oh, certainly. Yes, I am.
Brilliant.
Yes. And thank you, Joseph, for helping me with all my technology challenges.
Pleasure.
You're welcome. No problem at all, Savita. Nice to meet you.
Nice to meet you all. Thank you. Bye then.
Ta-ra.
Good night.
Oh, bless her. I must have spoken to her about 4 times on the
I know,
phone.
me too. Hi Duncan, hi Henrietta. Oh, you're on mute, Henrietta. Sorry. Kia, you're on mute.
Yeah. Sorry, terrible error. No, I think I'll go now. I've got to put my children to bed, and
Yeah. Thank you, guys.
very
I need
good.
to leave as well. Thank you so much.
Remember, you can still collaborate with everyone on the website, and we'll be in touch with everyone who's pitching to see what they want to do next.
Okay,
Thank you.
perfect.
Thank you. Good night.
Cheers, Henrietta. Cheers, Kate.
Thank you. Bye-bye.
Oh, Leo, you still here?
You're on mute, Leo.
I am too. Yes, yes. I was in the room with Keir the whole time.
There seems to be a busy room. There's a lot going on.
Yeah, yeah, there was. Yeah.
It was a few bits. Yeah, did he get what he needed? He disappeared before I quite grabbed him on the way by there, but
He there were a couple actually. So Gordon from the hub, he has got a company in Leicester who NWIS are wanting to find a project for, and he's got 30k behind it, which is a long COVID app that has been developed and what have you, and looking for collaborators. And NWIS have got until the end of March or something to deliver on something. So that was really interesting.
Yeah.
And then the second one was Fusion, which are involved with Respiratory Innovation Wales already. And they, Keir seemed to be quite interested in what they could also bring to the table. So they're going to try and arrange for us to have a demo of each separately in the next few days.
all right.
To see really interesting bit from what Keir wants to do, though, is a little bit what we were talking to the Welsh Medical Committee about, and potentially this thing in Leicester and this Fusion thing would provide the basis for tracking and trending people using off-the-shelf physiological measurement devices to complement or to augment GP primary care telephone consultations and outpatient appointments. So it has wider appeal,
All right.
which I think is really, you know, looking at something that can work across the board. And what Keir was really emphasizing is that he doesn't want any integration with the NHS. He wants this to be patient led.
All right. Oh, sorry, did I ask?
Because of data and information governance and the nightmare that you get into
because
when you try.
You can't be because it's almost impossible to navigate.
Pardon me, cutting across.
What?
If anyone who's joined is wanting to go to another room. So
No, I was just going to say hi to Leo. Hi.
Oh, hi, Cheryl.
I haven't seen you for years. How are you?
No, I'm very good. Yes, I'm very good.
Are you down in Hull Bar or somewhere? Is that where you
No, well, I'm still in Aberystwyth. I still live in Aberystwyth,
Oh, yeah.
and still spending a bit of time each week with the Bevan Commission.
Oh, right.
So yeah, but still working internationally. Well, working internationally from Aberystwyth. Aberystwyth has become centre of the universe, which is very nice for me, having spending time at home with when I was doing a lot of travelling, but all good.
But you look well. It's
yeah,
like,
I was just saying, I don't. Yeah, well, you too. I was just saying, I was in the room with Keir Lewis and Gordon. I can't think what Gordon's surname was now. He's working with NWIS on the digital the digital ecosystem hub thing with life sciences as well, and he was proposing a potential solution that he's trying to find a home for with his NWIS hat on, for a project which seemed to fit very nicely with what Keir was saying, with the idea that it's patient-held data, and we don't have to, at this stage in things, have the huge hurdles of information governance to have to go through, because that's always, as you and I know very well, a showstopper when you start to try to integrate anything with or share it, in any electronically enabled way. But if the patient is holding their smartphone and sharing it in that way, you potentially, for the proof of concept things, you're getting round that problem to demonstrate the learning as a proof of concept. And Keir, what he was wanting to do is track and trend the long COVID patients, because we just don't know how to manage them.
yeah, well, that's
What support they need, and which ones need to be brought in to be seen, and all that sort of thing. And we're not getting any real insights into an increasing number of people who will remain debilitated for some time to come.
Yeah, that seems a really valuable thing to be doing, doesn't it? It's obviously needed.
Yeah,
at the moment, isn't
and there seems to be some, and just that whole how many, feels like more than a decade we've talked about patient empowerment and things, but that has completely changed in the last 6 months. So we need to keep this door open, don't we?
I
promised to
need to go
give.
now.
Sorry, I wanted to add to this. Oh, sorry.
Oh, sorry, go on.
Yeah.
I went to the same meeting with Keir. And
Yeah, you were at the beginning, weren't you?
I forgot the name. I forgot the name of the guy in Torvine who's done something to gather patient-related data, and his name is Jim Wright. So Torvine
yes,
did a government digital services project to identify patient-generated data in a manner that was privacy protecting, and that so we speak to Jim Wright in Torvine.
Is that Jim with is that right with a WR?
WRIT.
Yeah. Yeah.
WRIGHT.
Yeah.
Because that what you would not want to do is to follow the same route that NHS Digital and NHSX went, which is they didn't look to try and protect the privacy of people when they were gathering data. It's all right, it's all well and good getting it, but you still got to get them to give it to the public sector. And there's some techniques that you can use to, like local differential privacy and differentiated machine learning, that you can get data in a manner that protects the individual's privacy. So yeah, I just wanted to add that because
thanks, Joe. I'll pass that on to Keir.
Hi, Emily, Sean. Sean, I just wanted to pop back in and say good night. The discussions are still going in a few of the rooms. So, and I know that I've got a few contacts that have come in through the rooms I've been in. So, well done for organising, and we'll catch up soon.
Brilliant. Thank you very much, Gordon.
Cheers all.
Bye. Yeah, Gordon, Keir's keen to follow things up.
He's got it
quickly with you.
Yeah, he's the first job tomorrow morning is dropping him an email.
Yeah.
Okay. Thanks.
Good. Thanks,
Bye.
Gordon. Bye.
I'm wondering whether a beer is in order. What do you reckon? I'm feeling it.
I say go for it.
Yeah. See you in a minute. Anybody else like one?
Oh, yeah, grab us on your way back.
Yes, please, Sean. That would be very nice. Yeah.
Hey, Wayne, sit down.
Hello, Tim. Dwi'n ôl.
Hi, Gordon.
Hi there. Hi, Emily.
Let me know if you need to be moved to another room or
I think I'm roomed out.
you're roomed out. Have you enjoyed it? That's the main thing.
It's been very interesting. Yeah, it's very interesting. It's really, I love, it's a really nice network. I'm not in Wales and everything works much better in Wales because it's a smaller, I'm not, you know, a nicely manageable area. And I think it works much better. It works much better. You'll do really
Right answer.
But thank you very much, and I'll be in next week, and I'll say good night.
Thanks, Gordon.
Thanks very much, Emily.
Okay.
Thank
Bye.
you. Hey.
Ti'n Wyn, ti eisiau mynd i'r ola?
Na, dwi'n iawn. Dwi'n meddwl sydd wedi bod, mae mhen i'n troi dipyn bach o fan. Lot o gyfyd i fewn.
Ti ar y SMP2 a falle beth bynnag dweud?
Ynddo.
O, na fo, ti wedi dal i fynd efo pobl pan ti isio. Good stuff.
So, beth di sgediwl chdi fan efo hwn yma, lle da ni'n... Beth yw'r deadline i pobl dod yn ôl, lle?
Wel, fe na i di na e-bostio pobl mewn couple of days a gofyn lle maen nhw arni. Pa rei sydd jyst i dropio allan, a pa rei sydd eisiau mynd ymlaen ac os dyn eisiau help a dechrau cymhario.
So ti'n mynd i beth i cloi hwn i fyny, lle?
Na, just gafo pawb tan maen nhw'n done, basically.
OK. Dwi'n meddwl bod fi'n weld yn o'n.
Mae'n dechrau, mae pobl dechrau blynod yr yma.
Gret. OK, dwi'n mynd i ymlacio.
Na fo, diolch Wyn.
Diolch yn fawr pawb. Ta-ra.
Da.
Yeah, I think I'm going to make a move now as well, Emily. Very, very well organized as always. I thought the breakout rooms worked really well as well. So I'm going to need to pick your brains about that as well, about how to self-allocate as well. So I feel that was a really nice touch as well. But yeah, give me a shout if you need anything else, anything from us. Yeah, otherwise we'll be in touch tomorrow.
Good stuff. Thanks, Alistair.
Awesome. Thanks, Emily. Thanks all.
Sean returning with his beer.
Cheers.
Ah.
Give people a memo that they need to make a note of people's contact details before they leave. No broadcast message.
That is remarkably nice.
Room's still open.
Right, so we've had, I think that was about 30 more than last time.
Yeah.
Yeah, give or take.
Oh, there was 127, I think, at peak on it.
Yeah.
So, yeah.
I thought I saw 133.
Oh, maybe even, yeah. That's
But
good.
I don't know. Then we had how many pitches in the end? 30?
A bit less than that, I think, just under 30.
Because there were a couple of doublers we missed out, weren't there?
Yeah.
So I'm glad we didn't see them.
But it's good in terms of a reasonable number, I think.
Yeah.
How many got people going into the breakout rooms apart from the picture?
All apart from, I think, 2 had people going to their rooms.
Right.
What, first time round or at all?
At all. Well, I think, unless someone went in without me having to sign them, but nearly all the rooms had people in them. Apart from that, I saw 2 rooms that were just people on their own. So that was good. Because I think last time we had a couple that were empty straight away and they were just like disappointed. So it doesn't seem to happen like that this time.
Because when I went through the through the lists, I saw only one. There was a loan.
Well, that's good.
And they were joined with about 5 minutes later by somebody else.
Oh, that's good. I've not been able to keep quite as close an eye on them, so that's good to know. Oh, that's another room closed. You can tell a room's closed because everyone just comes back here first. 1, 2, 3, 4, 5, 6 open.
I think what's nice as well is that people have been able to get together beforehand. I know, you know, Melissa was talking about one of them earlier, but the room where I thought there was nobody, they'd already been in touch with somebody. So the person that they were talking to went somewhere else first and then came in to have a chat with them. So you know, the platformness and the sharingness of things has got people talking to each other beforehand, I think, nicely.
I think that helped a lot, didn't it? There was much less of the confusion that we had last time where people came in and went, I can't remember which room anyone is in. So that's good.
Yeah.
I'm just popping my head in to say cheerio, everyone. Have a good evening. Get a cup of tea. Cheerio.
Sean's got a beer, so he's got the right idea. Bye. Sean, really interesting, the number of physios again.
Yeah, there's a lot of physios. There's always physios and OTs are always involved in this kind of thing. There's something in their something in the way that they are working, I think, or maybe there's something in that attracts physios. Maybe you know, there's something like that physios generally struggle to get money from other sources. What do I know?
I think physio got the more challenges than anybody else now.
Yeah. But yeah, physios are always strong participants in project programs and stuff.
Yeah, that's why I got the 3 challenges.
Yeah. How did you get on, Rakesh?
I think I got the solution from 3 projects, and there is some hope from all 3 actually. So it looks quite promising. So we got another meeting on Thursday. So hopefully we got about 3 different the 3 different sites. So Swansea University and another gentleman and the 2 other ones. So they're quite interested. So it looks like we're gonna hope something. Yeah.
Are you able to do all of this work on top?
Well, it's just I know it's very difficult, but at least one is like a frame. That's something very important, because that's it's very challenging. People with the dementia, they just keep forgetting, and they have a lot of fall. Actually, I'm doing PhD and part-time PhD, and this is a part of it is like how to prevent falls. So and we all the time we're seeing this thing. So this sounds like I have to work on there, but it's not very difficult thing. Probably can be done, but other thing like doing exercises in virtual reality or maybe from home, that's something that I'm really interested with that one. So and with the card, I think looks like the name badge. It's a very simple solution. It can be done with few things. So probably it's very difficult to decide which one to go for, because that's not my area for a clinical area. It's just the badge is completely different. So it can be done from the IT side. So I think I'll leave that one. But on two side, definitely I'll look into.
Can you push the badge one onto the exemplar, Sean, that did the space distance badge?
So who's doing it? So I don't know. Is anybody else there?
You know what I mean, Sean?
Yeah. Maybe.
Well, I was just thinking it's a sort of a bit of a natural extension.
Yeah.
The other badge is non-identifiable, whereas this is identifiable.
Yeah, I think in all honesty, right, Helen did a burnt candles on both ends, largely because she was shielding and bored stiff, right? She's still shielding, but I think that she's trying to move away from the detail of that particular piece of work, right? But on the other hand, right, countering my own arguments against the idea, Helen could contribute a lot to the conversation. Might be worth talking to. Whether she's able to drive this herself or able to offer some insight into how to shift things forward, and in particular maybe connections from a shifting things forward perspective, because one thing that she's done a lot of over the last few months is gotten to know a lot of people, particularly across different organizations and charitable organizations and various other things. So yeah, good. Maybe worth a conversation. Are you interested in a conversation, Rakesh?
I can be more. I don't mind if anybody's interested. That'll be okay. Yeah, no problem at all.
I mean, I will endeavour to remember to send that email tomorrow.
Okay, no problem. That's fine then. Yeah, because I can't handle 3 of them together. I don't. Yeah, Simon is there as well, so that's what we were discussing. I think he was quite helpful for me in the last challenge as well. So I think we're going to work with again. So we got a good company now. So hopefully it will be useful again now.
Yeah.
Yeah, sorry, if you want me to present something for you, Rakesh.
Yeah, yeah, no problem. We'll discuss it definitely. We'll do something. Yeah.
Okay.
Okay, I think I'll leave now. Thank you very much, everybody.
Have a good rest of the evening.
Thank you, and you too.
I'll see you next week.
All right, see you next week.
Bye.
Ta.
Bye.
Bye.
Any further reflections on things whilst we're sitting here thinking about stuff? Kirsty.
That was good. There was some great projects there, and there was some great working out, and potentially a few groups that I was joining don't necessarily now have something to pitch, but it's been great to bring them together, which has been really good to see.
Yeah.
I thought Madeline Boots, that was an interesting one that I've just been in just now.
Yeah.
Which was the Cardiff University. Really interesting. I thought that all the pitches, the 1-minute pitches, were fantastic.
They were. Do you know what? Right. Something has changed. I don't know what it was, but because I think we sent out the same information, but traditionally people have been terrible at doing 1 minute pitches. And tonight they were, everybody was on the money, you know, and we've flashed clocks in front of people before, and it's had no effect, has it? You know, so I
was shocked by that. I've got to say that people just stopped at 60 seconds because I was expecting them to just plow on.
Yeah,
I think people are just really, really, really fed up with Zoom. So the shorter amount of time that they're doing something,
It has lots of novelty.
the better. Yeah, you get, you know, people are more eager to get into the discussion than being put on the spot, possibly, and that's made them more kind of concise. I don't know, but no, I thought they were great. I mean, I'd not been to a virtual hackathon before, so I've been to physical ones that Sean's been doing, but I thought it was really good.
I think interestingly as well, you know, not prone to I am occasionally to bullshit. There is I wasn't joking earlier when I said that there was some really good quality pictures coming through, and a good variety of stuff. You know, the last one we saw a lot of things that were related to immediate problems, where you saw, I need a telemedicine solution for this. I need, telemedicine solution for that. I need to be able to talk to people at a distance. Just reframing the challenge in different ways. Right? And probably about 3/4 of them were fitting into that kind of category. But this lot seem a bit more varied and different, and like we're back into the let's look at the future and where we're going next kind of thing, as opposed to how am I dealing with this nonsense that I have to deal with at this point in time. I
think they've thought about what's kind of missing in this new world that they're inhabiting, because they were kind of all almost had a COVID angle on them in one form or another.
Yeah.
But they'd gone beyond the as you say, you know, I need something to connect me with the people that I'm trying to support or care for, to, you know, we've got all this stuff, but what's actually missing? And most of them were incredibly patient orientated as well, which is really good. It wasn't about them or the system. It was about how can we actually help people and patients, you know, better deal with their lives and get on with their lives, be that meeting their health and care needs, or just generally keeping active, you know, that sort of thing, which is really encouraging, I think.
Definitely.
Sean, I think.
I don't have a look now. We got 3 rooms with people in, basically, I think, haven't we?
Yeah, room 3, room 16, and room 24.
Yeah. Lois is sitting there by herself for some reason.
She's been there for a while, so I don't know if she's
Tony's there with us.
Oh, Lois was in a room that somebody else had left.
Yeah, she's in with Rakesh.
Rakesh is gone.
And Rakesh is gone.
She might just be in there for some quiet time.
Rob Kane is still talking to people. Samantha's still got a big group of people in there. Oh, actually, 2 of them are called the same thing. Is James Norris like in 2 people or 1?
He accidentally joined on 2 devices. I don't know if they were both him or one was his friend using his device.
Oh, okay. Oh God, David Hanisat is in with John Wells. That's good.
Sean, do you usually have so many that are sort of primary care focused, or are they usually secondary care, or is there always this mix? There's quite a few that
It's an interesting question. I can't answer it.
Yeah.
They're usually quite mixed, aren't they?
Guessing a little bit. I would say that most things will tend to be out of hospital, Right?
Yeah.
So I don't know if that's a useful distinction. Because but sometimes, you know, you get things that I might confuse between in hospital and out of hospital related to the location of consultation, for example. But yeah, probably last time was definitely a lot of what you might describe as community stuff. And probably, yeah, generally a lot of remote kind of things, more than hospital-based things. I mean, I think maybe hospital-based stuff will tend to be a bit too complicated for this sort of program, and will tend to be general management-led type solutions to large volume problems, you know, when shifting people. Whereas you tend to see some gadget type stuff coming through here and a lot of app type stuff. But there's so much less app type stuff in today's conversation than normal as well. If you think, Emily, you know, yeah, there's almost nothing that I immediately relate to an app.
Well, the last one, people were almost saying, we want an app that does this.
Yeah.
And yeah, there wasn't as much of that. And do you know what, actually, this time around, hardly anyone said their own solution. People were really good at just saying the challenge. So that was really good.
Right, well, I'm gonna leave you all, but thank you for allowing me to be part of it. It's been brilliant.
Thanks for
really
helping.
good.
Thanks for helping out.
I have mentioned to a few people about the funding from NHS charities, and if you don't mind, Emily, sending round that message that I put that I sent to you earlier, because I think there's quite a few possibilities there. With basically NHS charities together have just announced another 50,000 per health board that's specifically for helping with second wave activity, basically.
Okay.
So some of this really fits quite nicely with
where and how, maybe, right? Would you like to? Sorry, you've reminded me, basically. So sorry for hanging on to you for a minute. The next step, right, is going to be the presentations, and then we will get, I don't know, let's say we get 5 teams to come forward, right? Part of that statement earlier, you know, we're going to milk this for as much as we get, is going to see how we can stretch that, not only around how we can support the initial development, maybe in an MVP type thing or something that we can take into a test, but also about how we might turn that into something bigger, right? So if we make assumptions that we can deliver a testable product that we can run for a month or 2 months within a few weeks, and we move forward, there's 2 things there. One is about the next step in terms of development, right? But there is also the bit around stretching the money that we've got as far as it'll go to do as much damage as we can at the front end, right? If we were looking at the charitable funds as a potential source of funding for that small cocktail that we hand over the first time around, right? How would we involve people in that process, so that charities can have the opportunity of participating in the conversation and then deciding whether they want to support that project or not?
That's a really good point. So where we were at a few weeks ago, I suppose, was that we were suggesting, or I was suggesting, that we put in an application for £10,000 and get that money, and then almost you as the panel would decide where that money should go, but allocated to the relevant health board, because obviously the BCUHB funds must support BCUHB staff patient projects. So that's where we were, and then we entered a bit of a dialogue with colleagues who were saying, well, actually the best thing to do is to
say to all of those taking part, right, if you've done well and you've got an idea, then apply to your charitable funds committee, to the charity in their health board for that additional funding. And if they find out that they have been successful in getting the funding from this hack, then they would have a very strong case with getting it matched, if the funding's there, from their charitable fund, especially if they have the backing of their research and innovation team as well.
Yeah.
So Lynn up in North Wales, etc., and her counterparts elsewhere. The difference in each of the slight complication as well is that depending on which charity you're looking at, different health board charities, they're so different in terms of the way that they are set up. So some of them don't are just a finance person overseeing funds, whereas others are far more active, like we are in North Wales, where we actively seek out projects that align with what our strategy is of the charity. Hence why the hack is so good for us in North Wales, because we can, a lot of what the different staff are bringing to these are exactly what we want to be funding in terms of the innovation, etc. So therefore it depends on the health board, it depends on the charity they've got. But the big difference this year in comparison to previous years is that there is all of this COVID funding that is coming. Well, for many of us, it's already here, but there is now this the stage 2 and stage 3 of this COVID funding from NHS charities together, that's specifically around resilience, long-term resilience, which is exactly why it links so well with today.
Yeah. So slightly different question then. If a project came through as a winner, should we say, because I'm not going to be playing with anybody who's not a winner, right? That's other people's game, I would say, right? But so being rather selfish around it, if a Betsy project comes through as a winner, right? I would come to you and we would have a chat about whether you wanted to contribute to that project based on whether it fits in with your sort of objectives as Hourglass, right?
That's exactly right.
If that project was in Cwmtaf, who would I talk to, and how would we get them involved? Do we know the answer?
Yes, so they've got, so down in Cwmtaf, they don't have a very strong, they've got funding, but they don't have a very strong charity team, or a big charity team. They do have charitable funds, a charitable funds committee. So the best port of call is to go to Cwmtaf's research equivalent of Lynn Grundy and say, look, we need that match funding. Can you source it out? And then the equivalent of Lynn Grundy would then go to the charitable funds committee and say, look, we can match fund this. Let's go for it and complete the application.
Okay, so as a starting point at least.
So the starting point would be with the.
You need to make sure that whoever is leading on the research and innovation within each organisation knows that they need to see sorry, I'm trying to think of the right words, but
they need to be tied in with their charitable funds committee in their organisation. Most of them should already be linked in the way that Lynn was already linked in. But it's not necessarily something that would be on the forefront of their mind, I suppose, to ask for charitable funds for something like this.
But yeah, okay, that makes enough. That gives me enough to work from, I think.
What I've provided for Emily is a message to send out to all the applicants to say, if you need additional funding, you should be getting in touch with your NHS charity to request that funding.
Yeah.
So to putting the ball in in the in those that have put forward.
But is there a list of NHS charities and emails and things that we can...
So I've sent the details to Emily today, all the different websites, and that's what we've got at the moment. So we've got all the different websites there. We've got all the different email addresses as well, and they were all in NHS charity representatives have been invited to hear. Hopefully they'll come next on the 17th and be able to see what exactly is happening.
Yeah, nice.
Yeah.
Okay, thank you very much, Kirsty.
No, thank you. Thank you
Sorry
all.
for keeping you an extra 5 minutes there.
Not at all. Lovely. Good to see you all. Well done.
Brilliant.
John. Cheers. Well done. Cheers. Bye-bye.
Bye.
Do you want me to send a message to the room, Sean, asking them to start exchanging details?
Go on. Let's wrap it up, shall we? I mean, there's only 2 rooms going in there.
Yeah.
I mean, to be honest, Emily, I don't mind leaving them there, right? As long as they know that they're there on their own and not to expect us. I mean, are we able to leave them there?
We'd have to make someone a host, and then if they left, they would close the meeting. So I don't mind staying.
Well, I don't want you hanging around here for just for the sake of other people. Send him a message, tell him to bugger off.
I'm trying to politely frame it. Hello.
Time to go, which in most people's cases, they're already there. I know, have a look, see how popular I am on Twitter. Oh, quite popular is the answer to the question.
Two rooms still active. I've had a look at social media all night, actually. We've got a marketing support officer now, so it's really good to just let someone else look at that whilst I'm doing events.
Oh, right, that was somebody else, was it?
Yeah, so that was Jamie, who you saw there. Oh, he's done a good job, fair play. He's got a picture of you in a cowboy hat, Sean, that's the main thing.
Hey.
Oh dear.
Yeah, that was quite nice. Some nice comments and stuff coming up on Twitter.
All the feedback that I've had has been really good. People really enjoyed it. Not as much confusion as last time as well. Last time there was a lot of people who were like, I'm not sure what I'm supposed to do, and I've not seen any of that yet. So that's been really good.
Bevan Commission has just been followed by somebody called Angry Ethan.
Oh, that's never a good sign.
No. Sounds like somebody who's trying to create a YouTube profile for themselves. God, I look like a complete plonk in pictures sometimes, actually.
I'm glad you recognise that in yourself, Sean.
Thanks, Leah.
I
do pride myself.
Apply it to your apply it to some of your tweet photos then, and get your mugshot shot out of the photo so that we can actually see the view.
Yeah.
We don't want to see your mugshot, honestly.
No, I thought it
No.
added its character and value to the pictures, Leo.
No, that's you leave that to people's imagination, Sean. That's the beauty of paintings and things. You know, it's in the eye of the beholder, remember.
Yeah. I think yeah. Yeah. I pride myself on my self-awareness and my ability to accept constructively feedback that is that is aimed at helping.
Yeah, there's a little bit of that statement that you missed though, which is and apply it.
Yeah.
You can accept it all you like, you know, and it just gets a bit tedious saying the same thing, you know. You know, I was expecting a different hat today as well, you know, and
Yeah.
Why
on earth would you?
You didn't delight.
Do you think I've had time to go out and buy a new hat?
Well, I thought you might have rummaged through Alma's wardrobe or something, you know.
Oh, Alma hasn't got any hats of this quality. Oh, what's this? Right. The people are still in the rooms. Emily?
Yeah, I'm just giving them a little nudge.
I think I'm going to go in and see them.
Okay, thanks, John.
So where should I go?
Burner's in room 3 with Robert Kane. Room 16 is the only one left open. I don't know if sending Sean in is the best idea. He'll just keep talking to them now for ages.
Yeah, he will. You're dead right, Emily.
This is a message for Sean. Please stop talking. Oh, dear. Joseph, you can probably head off now, you know. I reckon everyone knows where they are with the think you do.
Oh yeah, well, you just what time do you think you're closing it? I only say because I'm reading here as well, so I am multitasking.
No worries. I don't think it'll be too long now. Maybe 10 minutes.
I'll stay in for the duration.
Yeah.
I'm assuming I get a badge or a certificate.
Thanks, Joe. Oh, he's back. You're on mute.
Job done.
Did you just go in there, go, everyone go, just leave now?
Go, Mizet. Right. Yeah, there we are.
Oh, there you go.
Yeah, I'm gonna go and see if what's the names are still there now.
Room 3, yeah. Thanks, Samantha. Bye. Don't know what you said to them, but they closed that down very quickly. Ti'n iawn, Tony? Ti efo ni? A ti ar mute, ti'n fel?
Wel do, Emily, di dal y fyw.
Nes ti joio?
Do, da, chwarae teg.
Ond dwi'n meddwl, y well ar y dwytha doedd, mwy positif a mwy, dwi'n gweld challenges well, rhywsyd.
Oedden nhw'n wahanol fel y Sean y Iechyd. Bechod ar ei neb o mental health troi fyny na ddo?
Na, wel, nath a un. O, na, nath nhw'n troi fyny na ddo. Nath nhw'n rhoi y pitch yn yr Simply Do, nath nhw'n troi fyny.
Ie, bechod e.
Ie, o hwnna'n un da, un o hynna fyd. How is it looking, Sean? You're still on mute. There we go.
I think that's it, ladies
Oh,
and
there you
gentlemen.
go.
Yeah. Thank you. Thank you very, very much.
Thank you.
For, another wonderful evening of innovation. And I'll see you. Do we want to get together maybe on Friday or something, just to have a chat and a catch up in between?
That would be good, but the rest of my week is pretty full up. Send something anyway, and then we'll see who can make it. We'll try and catch up, even if it's just over email.
Who's sending
You're on
it?
mute, Spinner.
I was saying something very important. I could do with another catch up, be honest with you, because now I managed to dip in and out a few rooms, but then I obviously I didn't see everything. Then how will I know who talked to who, and what kind of companies talk to what kind of inventors? Are we going to have that information before next week, or are they just going to surprise us on 17th?
So what we'll do is email them all in a couple of days, either Friday or Monday. Oh no, Monday's too late. Friday, and tell them, by now you should talk to everyone. Are you pitching or not? And we'll ask them what added value they've got, so we can build a picture around what they got out of the hack, whether they're going to pitch or not, and where they're moving forward. Also, they will still be going onto the Simply Do platform and collaborating on there, so we should see a lot of the collaboration.
There you go. Yeah. Because there are a few projects, number of projects we liked, but some of them we can't really take them on. It will be lovely to take them on if there's a collaborator. So it's important to know if there's a collaborator already, or there's nobody, we have to do everything from scratch. So I like to know that information. So that will be available by Friday. But again, if you want to meet face to face, I'm available.
Brilliant, thank you.
Okay.
Good stuff.
Super duper.
Everyone is knackered, so I'll leave it there.
Tired, you feel it now.
Just staring.
Right.
Brilliant.
Brilliant. I will see you all again shortly. Thank you very, very, very much.
Thank you very much for organizing the event. Thank you very much, guys. Bye-bye.
Good to meet you all.
Bye-bye.
We'll be in touch tomorrow, Sean.
Bye-bye.